Assalamu alaikum, everyone. Good afternoon and Jum'ah Mubarakah. We hope you're all having a wonderful day so far. My name is Payam Amin Seido. I am the head of the logistics and organization team, and I'm joined here with my co-head Raghad Al-Mutayri. On the behalf of the Saudi Association of Neurological Surgery Medical Students Chapter, it is my pleasure to welcome you to the first day of the first ever Neurosurgery Virtual Open House in the Kingdom of Saudi Arabia. At SANS MSC, our mission is to enhance the academic and professional experience of medical students and interns across the kingdom and to support them in exploring and pursuing careers in neurosurgery. This initiative brings together neurosurgery program directors from across the kingdom to provide valuable insights into residency training and guide aspiring neurosurgeons in their journey. Each session will offer an overview of the program structure, the clinical exposure, research opportunities, and what to expect from training and residence life. We are truly honored to have the participation and the support of different program directors from across the kingdom, and we hope this initiative will benefit all of you, inshallah. Please note that after each session, we will have a 5 minutes Q&A segment, so hold your questions till that part. And we look forward to having a productive program with you. We will start with the Eastern region. So please join me in welcoming Dr. Mariam Al-Rashid, the Program Director at Imam Abdulrahman bin Faisal University Board. Dr. Mariam, the floor is yours. تفضل.
Thank you, everybody. I don't know if you're hearing me well and if you're seeing me well. So, I'll be sharing my slides. Do this. Okay. So let me know if you're hearing me well and if you're seeing me well.
Victoria, your voice is just a bit low. If you can kindly raise it a bit, otherwise everything is perfect.
Okay, can you hear me now better?
Yes.
Okay, that's great. So we'll start. As mentioned earlier, I'm the program director for the IU Neurosurgery Fellowship in Imam Abdulrahman bin Faisal University, previously known as the University of Dammam and previously known as King Faisal University in Dammam. So we're going to start with a little bit of history. So it's interesting to know that the medical college in King Faisal University was, I think, the second college of medicine that was founded in Saudi Arabia. It was founded in 1975. I think after King Saud University in Riyadh. There was two components of it. There was one in Dammam, located in Dammam, the Eastern Province, and the other branch was in MSC, also located in the Eastern Province. And earlier on, the King Fahd Hospital University was also founded, actually was created with the Ministry of Health, to train the medical students and to incorporate the clinical practice there. And then after that, the IO, previously known as King Faisal Fellowship, was established. So the neurosurgery program actually in Saudi Arabia was first founded in King Faisal Fellowship. So there was no neurosurgery training in Saudi Arabia. All the neurosurgeons at that time were trained in Germany, mostly. In 1987, the first neurosurgery training program in Saudi Arabia was established in Imam Abdulrahman University, as I said previously, known as King Faisal University. It was a joint program between our institute and King Faisal Specialist Hospital Research Center in Riyadh. Dr. Kanaan, Dr. Mahar Al-Sunya, and Dr. Al-Harbi, and Dr. Ahmed Ammar from our university were key members who established the program. So, and 8 years later, the Saudi Commission, inspired by that initiative, took the curriculum and the regulations from King Faisal University, IU, now currently known as IU Fellowship, and established the Saudi Commission Neurosurgical program that currently still going on. So in Saudi Arabia, you have to think of, we have the Saudi Commission Neurosurgical program, which is a program, and independently, we still running the IIU Neurosurgery Fellowship or Residency program. So they're two independent entities. Initially, they were really operated and a lot of collaboration was going on, but now they're two different entities. Okay, and since the 2000s, the name of the university changed, and therefore the fellowship name has changed, but basically it's the same fellowship. Now we're an independent entity. That means we're not anymore in control of the last branch, nor an upper bottom branch. So we just have control over the department, neurosurgery department. Now, the philosophy of that training was really inspired by the people who founded it. So it was, as most neurosurgical programs, and it was at that time, heavily incorporated the clinical practice with academia and with scholarly activities, so research. And we still, the spirit of that program still continues to that day, in the sense that there's a lot of focus in the clinical practice, knowledge, and surgical skills when training the residents, but also in academia in the sense of trying to promote the involvement of residents in teaching medical students or other fellow residents, and also to encourage scholarly activities. That means involvement in research, whether basic science features or clinical research, and that leads me to the my second slide. So as I said, that program has been established in 1987 and is still running 50 years later. But now it's, I would say, in the past, since 2020, so 6 years ago, there has been some kind of rejuvenation of that program. In the sense that, along with the Saudi Commission, we tried to incorporate the CANMEDS, which is part of the Royal College in Canada, standard for evaluation of the residents and the training program, but also trying to incorporate the CBD model. And I think this is a key distinguishing factor of our program versus the Saudi Commission program. That the CBD model, which is basically short for the competence-based by design, competence by design model, is basically shifting the way we train residents. So we've been working on that since 2020 with the Royal College of Canada, Physicians and Surgeons of Canada, basically trying to adapt their methodology into our residency programs. So not just the neurosurgery programs, actually all the programs in our university, because we have different programs. So the CPD model, in a nutshell, not to bore you with logistics, but I think it's very important, is basically traditionally the way the residents were trained or evaluated, and a decision made whether there are certified neurosurgeons or not was based on the in-training evaluation reports, and then an exam that is done by the end of the residency. And there was two components, the oral and the written exam. Now the CPD model, it has different kind of components. So it does still keeps the in-training evaluation reports that you get by the end of rotation. Also emphasize what we call the EPAs. EPAs is short for entrustable professional activities. So what does that mean? That means people, neurosurgeons who were involved in training the residents, went on and tried to understand what are the important milestones for a neurosurgeon to achieve, okay, a neurosurgeon resident to achieve in order to be an independent and competent neurosurgeon in the future. So they went in and tried to dissect the program, really dissected and tried to understand the cause of this discipline. So they came up with these 61 entrustable activities, and mostly they're surgical activities. Okay, so surgical technical skills. For example, one of them is inserting an external ventricular drainage, for example. So they make sure that this resident has to show that he was involved, let's say, in 5 or whatever number they agreed on, in inserting an EVD, which is an external ventricular drainage, competently. So that means that the consultant or the staff or the senior resident or the specialist who was watching that resident felt that the resident was masterful, able to accomplish that kind of activity independently without him being in the room. Okay. And that resident could try 5 times, 6 times, other resident 10 times, other resident 15 times before establishing or being competent, quote unquote, in that activity. And that's fine. There's no judgment. Okay. But the idea is we cannot treat residents anymore equally. Some residents have certain skills that they can acquire quickly. Others need more work. Okay. And again, there's no judgment interest and sense of who achieves this, which milestone quickly. It's all about, are you achieving it or not? Okay. Based on your level and your context and your experience. So they went through that. Okay. The other thing is trying to make sure that the R6 before they move on into practice, because one day you're an R6, the next day you're a staff. I know in Saudi Arabia the regulation is a bit different, where you have to have 3 years as a senior registrar before you are as a consultant. But in Canada and in the US, where I trained, is basically one day you're R6, you pass your exam, the next day you're a staff, you're a consultant or attending physician. You're able to practice by yourself independently. So the idea was to make sure that the last year for the resident is equipping that resident to be able to have an independent practice, the confidence, the tools, okay? And this is where we call the transition practice. So if you look at this diagram here, it says transition to discipline. This is usually the first few months when you are a medical student, as well as you are an R1 resident, okay? So what tools we can help you, what EPAs you need to achieve, okay, to be in that stage. And basically, usually most residents will achieve this transition to discipline. As you can see here, it's called an ND transition within a few months. Basically, proper clinical history taking, examination, decision making. Okay, but then you move on within also the R1 to the foundation of the discipline, and this is the foundation of the neurosurgery. So, what as a neurosurgery resident do you need to achieve? Okay. To be part of that discipline, the neurosurgery discipline. So that would be history taking in neurosurgical patients, examination in neurosurgical patients, picking up emergency in the neurosurgical context, a patient who's herniating, for example, a child involved in a head trauma, with an ICH bleed, with a blown pupil, so these kind of things, okay? And then gradually, as an R3 and R4, you're moving to the core of the discipline, okay? And this is where most of your senior years will be. So this is basically mastering, you're now beyond this basic surgical skill and basic clinical skills. Now it's more about your decision making and coming up with a plan for that patient by yourself, the surgical approach, dealing with the complications of that surgical approach intraoperatively or postoperatively, and then the refined surgical skills that you need to perform, for example, supratentorial craniotomy, infratentorial craniotomy, dissectomy, and all that different surgical. And then from there, okay, you get the certification exam, okay, which is basically a written and oral exam, okay, and after that, you graduate and you become an independent neurosurgeon. So the reason I took the time to explain this, because as I said, I think this is until this point of time is unique to our program as opposed to all the other programs in Saudi Arabia, because we are adapting that. We've been adapting it since 2020, because we're hoping for the accreditation from the Royal College of Surgeons in Canada. So that's why we've been adapting this in 2020. Okay, so in the meantime, our institutes, starting January 2026, the King Fahd Hospital University, the King Faisal University, Imam Abdullah University, and also Medical City that just opened recently, has been accredited by the Royal College of Surgeons as an institute for the next 8 years. We have few programs that already have been accredited, like neurology and psychiatry and pathology. In terms of the surgical fellowships, orthopedic surgery has been the first to be accredited this year, January also 2026. The surgical foundation has been accredited last year, 2025. This is a very important because all surgical specialties in Canada are now also in IEU to be able to be certified as a specialty surgery program. For example, neurosurgery, you have to pass the surgical foundation exam because the first 2 years constitute a surgical foundation training, which I'm going to talk about later. We have applied in January for the accreditation for the neurosurgery program. The official reply, they're going to get back to us in May 2026 to say if we are a candidate or not. If we are a candidate, you will have a visit in January 2027 to see, to evaluate us, see if we pass that evaluation and become accredited. So that means if you train in our program, you'll be eligible to take the Royal College exam in Canada, the written and oral. And if you pass, then you get the Canadian board. So what is our curriculum looks like? So it looks very similar, I think, to most neurosurgical programs, including the certification program. So as I mentioned, the first 2 years, the PGYN and PG2, which relates to residency level 1 and level 2, are basically part of the surgical foundation. So in that competency by design model, the first 2 years of all surgical residents, so whether you're in the orthopedic program, neurosurgical program, neurosurgery program, general surgery, EET, or OBGYN, you are all under the cervical foundation umbrella. What does that mean? These are all joint, okay? So in our university, we have 2 major boot camps that has concentrated the academic activities pushed in 1 week from 8 o'clock till 6 o'clock. Basically, lots of lectures and lots of hands-on simulation training, okay, for basic surgical procedures like suturing, cutting, dissection, all that, sterilizing, scrubbing, and also a lot of lecture, because you have to have, as a surgeon, a well-rounded view of the surgical complications and the surgical foundations. So example, different type of sutures, okay? What do they mean? Different types of way suturing, okay? Which one you choose for what? And the way you scrub, how do you scrub, okay? The solution that you use, fluorescein versus iodine, does it matter? Does it matter the sequence of it, okay? Does it matter if you scrub or use the soap or use both the soap and the prep? So all that is actually part of the surgical foundation training. That's why all of these programs has to go through it. As I mentioned, because we are adapting the Canadian now model, that has been incorporated for the past 6 years in our hospital. You can see here, you're going to have some of the ICU, general surgery, and then neurosurgery, and the second year, neurology and radiology. After that, the surgical foundation, starting PGY3, you're part of the neurosurgical program. So every resident, surgical foundation resident, goes back to their discipline, okay? And you're under that discipline. But you see, it's always joint. So in the surgical foundation, you're not just doing general surgical foundation, you are doing neurosurgery, and you're being evaluated, and you are reaching certain milestones that you are expected to reach as a junior rebel, and you're going to operate and you're going to do clinical rotations in neurosurgery. But officially under the surgical foundation umbrella. By the end of these 2 years, okay, you go back to your discipline. Then the core of that discipline, which is the neurosurgery, is more intensified, as you can see. It's going to be more focused towards neurosurgical training. Okay. I would like to emphasize there is a lot of emphasis on research, as you can see here. We have 2 months allocated for research during your senior years to help encourage and give you this protected allocated time. Also, there's 1 month given as a surgical part of the surgical foundation. Okay, and also the elective rotation could be taken for research if the resident showed the program director that they have a clear plan of how to utilize that allocated time. So as I mentioned, the first year you're going to be part of the surgical foundation if you're enrolled in our program. As I mentioned here, this is a nice table just to see the sequence of events. So automatically, once you are accepted in the IU neurosurgery program, you'll be enrolled in the surgical foundation program. You don't have to do anything extra. Okay, and you're going to train in the first 2 stages of your residency. It will be training, as I said, simultaneously. So you're doing the surgical foundation, but also your APAs, such as like entering a central line, entering an arterial line, doing the intubation. Okay, so these are very important skills for you to have as a surgeon. But at the same time, you're doing also your neurosurgery APAs, like putting an EVD, taking history, detecting an emergency, and coming up with a plan for treatment. Okay. Then after you finish your 2 years, you go back to your core discipline, and then you're eligible for the exam for surgical foundation. So if you want to be Canadian board certified, there's 2 exams you have to take. One, the surgical foundation exam, is just a written MCQ exam over 2 days. You have to fly to Canada to take that. Okay. And now, as I said, we are accredited, so you can do that. So we have already the R1s on the R1, R2, sorry, R3s of this year. They're applying for it and they will take it. If you pass, then the other exam that you have to pass by the end of your residency is the certification exam by the Royal College, which is has 2 components: the written exam, which is a short answer exam over 2 days also, and the oral exam. Once you do that, you are certified. Now, as you go back to your core discipline, these are the rotations. So it is going to be all neurosurgery, but of course, we'll cover all the aspects of neurosurgery. And as you can see here, we do cover all the aspects in our program of neurosurgery, except I would say the complex peripheral nerve surgery. Still, there's some deficiency. We do the basics for sure, the carpal tunnel, the ulnar nerves and disposition, trauma, but the complex peripheral nerve surgery still we're lacking. Now, along with the clinical rotations, as you can see, we have a dedicated academic program also during your residency. So it's not just clinical practice, covering calls, doing clinics at OR, but also there's a big educational component of it. So we have protected academic days. That means no staff is allowed to reach out to the resident to cover clinic or on-call or whatever. These are protected times, and they include weekly ground rounds given by the residents to promote the residents' skills in presentation, in researching latest evidence in terms of the topic that was assigned to. So we take this very seriously. There's weekly lectures given by the staff, whether the neurosurgery staff or staff from the other departments that are related to neurosurgery. So we have people from neuroradiology giving lectures, neuropathology, neurology, ENT, orthopedic spine surgeons, also to make sure that you have an enriched experience. Case presentation, this is basically the residents presenting cases that they have seen during their on-call or during their elective admissions. There's monthly MM rounds also and journal clubs. Twice a year, we have simulation-based training using human placenta to try to, because as we know, the vascular neurosurgery has been more and more shifting towards minimal invasive, endovascular, So the exposure of their current residents is not the same anymore as it used to be in my time and previous time, where a lot of open aneurysm surgeries were done. And that's why we try to compensate with that by doing this human placenta model, basically teaching the resident how to dissect around the arteries, how to do anastomosis of arteries to still maintain these fine-tuned surgical skills. Also, we do annual and training written and oral exams. We are part of the evaluation of the resident, but also to help the resident to practice how to answer these exams in preparation for their final certification. As I said, I would like to emphasize the research curriculum that we have. We've been working on it for the past 2 years, trying to encourage residents because it does affect one, the patient, the residents, or as a staff, or their consultants, or their promotion, especially in the position. Two, really helps to have these tools in order to publish and to also critique and be able to incorporate that evidence-based medicine into your practice. So this is the recent our research curriculum. There's going to be a mandatory part when you enter into our program. You have to complete a research methodology course given by the epidemiology and family medicine and community department in our university. It's for free. It's an intense course for a whole week, again from 8 o'clock to 4 p.m. And there's an exam by the end to give you an official certification. That includes all kind of research knowledge that you need, basic research knowledge in terms of different types of studies, how to make a question, how to come up with a hypothesis, how to write a proposal, and all that stuff. And also there's an online research bioethics that you have to take, okay, that is given by Abdulaziz City Institute. We do, as I mentioned, have monthly journal clubs. We develop this mentorship pairing, or basically, depending on the residents' interest in research, we pair them with the proper staff, so you'll be able to come up with a research question and work on it. As I mentioned, we have a dedicated research line. 1 month is allocated in junior years, 2 months as a senior year. And also, you have the option 1 to take your elixir rotation as a research rotation. And also, we have a formal resident research director that you can consult to make sure that the research you're working on is it worth working on? Is it feasible? If you need any kind of funding, how to apply for these funds. And as you mentioned, the initiative of our university, as you can see on the right side here, to encourage residents to publish. They are having some financial incentives put in since 2026. So where is the training going to happen in our program? So 75% of the training will occur in both our hospitals, the King Fahd Hospital University in Kuba, and also the new Imam Abdulrahman bin Faisal Medical City that opened last year. Okay, and it's going to be Advanced Oncology Center in the Eastern Province. So this is where your expected monthly rotations. Now, we acknowledge that we have some deficiencies in terms of the load or the certain subspecialties in our program. And to bridge efficiency for now, we have a collaboration between King Faisal Specialist Hospital Riyadh and King Fahd Medical City Riyadh, where basically the skull base / vascular rotations and epilepsy functional rotations are done there. So you are expected, if you go, if you're part of our program, to do 6 months of rotations in King Fahd Medical City or King Faisal Specialist Hospital Riyadh, and to do 6 months of vascular / skull-based surgery in one of these institutes. Okay. The other thing, in terms of the trauma exposure, after the kind of research allocation of these Jama'at, again, the number of trauma cases in our hospital came down. To bridge that deficit, also we have a collaboration with the King Fahd Hospital University in MNGHA, where they have big numbers of trauma. So also we're expected to do a 6 month there of general and trauma neurosurgery. The other institutes like the trauma faculties around colon care or the Bahrain, things that you can do, whether it's an elective, we already have a collaboration with them, but it's not necessary in any sense. And also, because we are, as I said, heading to that accreditation for the neurosurgery program by the Royal College of Canada, now the university is willing to sponsor residents who are part of the program to have a 6 month rotation in Canada. Okay, it can't be an absorption, it has to be a hands-on rotation. So that means you have to go through the certification process in terms of taking the MCQ1 exam, which is the medical examination qualification exam in Canada as a medical student, and the NCS, in order to make sure that you have a hands-on experience, and they're willing to sponsor financially that rotation, and we encourage that you do it in your senior years. That way you get more experience, and also you get prepared for the Royal College exam. So if you are part of our group program, this is the requirements for graduation. Okay. As I said, for now, it is not mandatory for you to go into the surgical foundation or the neurosurgical certification exam in Canada. But I think once we get the accreditation, if it's next year, 2027, I think it's going to become a mandatory requirement. As I mentioned, for now, our R2s, R3s are applying for the Royal College Surgical Foundation exam, because if we get the accreditation next year, they want to be able to apply for the Canadian board along with the IU fellowship certification. So you're going to have both the IU fellowship certification and the Canadian board. So for people who are interested, what is the application requirement? I guess it's similar to any program. You need to have your CV, okay? A medical degree that is recognized by the Saudi Ministry of Education. Of course, your transcript. We need your medical licensing, the Saudi Commission for Health Specialties, and your SMLE. Minimum of reference letters, and also a consent that you, your sponsor or your employer are willing to release you for a full 6-year training in our institutes. So how do we go about selecting residents? So this is our selection process. So once you apply through the platform of the IU electronically, what we do is we're going to ask you to take an exam. The exam is basically an MCQ, just to test your general knowledge about neurosurgery and anatomy. Okay, nothing fancy. Just to have an idea of your background, okay, in neurosurgery. Do you give us an impression of how much interested you are in that? Because if you're interested in reading about it, to have rotations in that discipline. 2, we'll be looking at your GPA and SLA score. I know people think this does not matter. Unfortunately, still we're old school, and I think all programs that was also part of the selection committee at one point in legal neurosurgery program, and everybody cares the GPA and the score. Here, the SLA score in Canada is the MCQ1 score. So the higher the score, the more likely you're gonna be called for the interview. After that, in the interview, basically, I always say what we are looking for, and I guess all programs, you are looking for someone who you can work with. Okay, nobody wants to work with a resident who is difficult, okay, with a bad attitude, arrogance, not functional, doesn't have any ethics. Okay, so you want to work with someone that you are able. It's good to have a relation with, able to talk to, you're able to understand, you're able to have a high ethics, okay, knows how to communicate verbally and non-verbally, okay, some professionalism, punctual, respectful to all of the surrounding, not just the staff, also his colleagues, his residents, the medical students, the nurses, all healthcare workers. And also to show an interest in that discipline. You'll see in the interview, we do ask some clinical questions, and I always say that we do ask. But actually, if you look into these clinical questions, or clinical scenarios. They're more to actually judge your decision making, your analytical skills, okay, how you prioritize things, how do you respond conflict, okay, uh, your understanding of authority. So it's actually more of your soft skills than your actually clinical skills. But at the end of the day, we are accepting you in a program to train you as a neurosurgery as a neurosurgeon. So I'm not expecting you to be a llama and to be like a reading accomplished neurosurgeon. Okay, even if you make some clinical mistakes, it's fine. But for us, what actually this clinical scenario to help us to see, judge how you think, how you prioritize, what do you do in stressful situations. Okay. And also the CV, I would advise you the way you put your CVs, and again, this is not just for our program, for all programs, I guess. You have to show in the CV that you have true interest in the discipline. Okay? And that by you having the lecture rotations in neurosurgery. Because at the end of the day, I want to know that the resident who's applying knows what neurosurgery entails, right? In terms of the lifestyle, in terms of the stress, in terms of the workload, in terms of the importance of time management, okay? Prioritizing things. So if they don't have that kind of sense of what neurosurgeon just because it sounds cool, I looked in Grey's Anatomy and it sounds like my dream is a cool surgeon or whatever. Okay. These things, it's not really what neurosurgery is about. Okay. The other thing, to see if that resident have any scholarly activity. You don't have to publish necessarily, although now I would say the competition is higher and higher because a lot of residents are able to publish. At my time, if you had one publication as a medical student, wow. Now I think it's becoming more competitive, but at least to show that you're involved in research, you worked in a lab, all that counts. Health advocacy, that you were involved or volunteering in symposiums or health awareness, all that jazz. Also, I think what filters, and I always tell residents, medical students, people talk. So sometimes you're gonna get a phone call from someone, okay, whether you know or you don't know, recommending certain resident or actually tracking with some resident. And these things are filtered, although they're not official, and that's why you look at the grade. It says unsolicited reference, unsolicited email, unsolicited verbal information. These things count, okay? It's really meaningful for me when someone picks up the phone and say, you know what, I work with that resident. She's amazing. Okay. Always on time, top of her game. Really not. Maybe he did not write a official letter for that resident. Okay. Or I'll get an email or a phone call. For me, it means something. Okay. Especially if I respect that person. And sometimes it's the opposite. Okay. A nurse telling me, like complaining, this resident of this medical student is arrogant. Um, really has some verbal abuse, always showing up late to rounds when you're not there, or to the OR, not knowing what to do. Again, these things we're human beings. We do put into account. So in the end, I didn't want to make that presentation long, but I would like to
Dictora, we can't hear you. Can't hear your voice. So maybe try to mute yourself and unmute again. Assalamu alaikum, Dictora. Can you hear us? Dictora, can you hear us? What is the voice not clear? While the doctor is working on the mic, please drop your questions in the chat box and we will make sure to address them, inshallah, once she fixes your technical issues.
Can you hear me now?
Yes, Doctora, we can.
Okay, I'm so sorry about that. Would I be able to share?
Yes, yes.
Uh, okay, just a second.
Take your time.
Okay, no.
Doctora, since the next speaker is waiting, let's just try to address some of the questions that were addressed to you. So the first question would be, how many seats do you have? So how many residents do you accept each year? And Doctora, by the way, you're muted, so I'm not sure if you can unmute so we can hear you. Doctora Mariam, can you hear me?
Yes, sorry. Yeah.
Yeah, no worries.
So ask me. Sorry, you said there were a couple of questions.
Yes.
Yeah.
There were questions, and since the next speaker is waiting, so we just want to address.
Yeah, no worries. Yeah.
Yeah. So the first question would be, how many seats do we have? So how many residents do you guys accept each year?
So for now, it's only one resident
Mhm.
per year.
Per year, okay.
Yes,
And
yes.
what
For
is
the
the
IU fellowship is one resident per year. Yeah.
Okay, awesome. What is the operative volume like for the residents?
So, because I saw someone asking that question, and I think it's important. In our institute, so far, we have two programs. So we do have the IO Fellowship Program, which is separate from the Saudi Commission program. Okay, so we have both actually in our institute. So we take one resident under the IO Fellowship Program and one resident under the Saudi Commission. So the Saudi Commission, you have your own application across the kingdom, and you can put the Eastern Province, and our institute is one of those accredited. And the IO Fellowship will have a different application process. But you're asking about the load, so to mitigate any what do you say التصادم في programs. So in the past 2 years, we are making sure that during a certain rotation or period, we don't have more than 8 residents in total, junior and seniors. Whether they're 50% from the Saudi Commission, 50% from the IU Fellowship, it doesn't matter. Sometimes the overwhelming Saudi Commission at what time IU Fellowship, but at a given month, we have 8 residents or less in our hospitals, okay, assigned on 4 different services to make sure that the load maintains at a certain level. So we did have some issues after COVID, again, like other institute, because of the certain regulations that happened, and also the slowing down of certain capabilities. Like before COVID, we had a dedicated neuro ICU, so we were able to operate regularly because of that. After COVID, because of the lack of nursing, they closed that unit, so we had to fight for ICU beds, and sometimes we have high cancellation rates because of that. But I would say in the last year, 2 things differently happened that's actually impacting now the volume. One, as I said, the new hospital, the medical city in the university campus has just opened, and slowly the spine service is being shifted there. So that's helping by increasing the spine load. So now they have 2 to 3 days allocated in the new hospital for spine surgery, and that allows more room in the King Fahd Hospital University once we are, and hopefully by the end of this year, the complete transfer of spine service will be there. So we have for the cranial services, which is the skull-based, the oncology, the vascular, and the pediatric neurosurgery, more allocated OR time because we're taking over the spine service. So this is a major change that's really going to help with the load. The other thing is now they opened the step-down unit, because as I said, one of the major issues was the high cancellation rates because of the lack of ICU beds in the cranial surgeries. So basically, now with the step-down unit that opened 2 months ago, we see already the cancellation rate for the ICU is coming down. It's not zero still, but we're very hopeful that that initiative and also the initiative of reopening the neuro ICU will allow for more load to happen. So for now, I would say we have 3 OR days in King Fahd Hospital University and 2 RR days in the new medical city. But the 2 hour days in the medical city are purely spine surgeries, neurosurgery, but spine surgery.
Awesome. And what is the on-call schedule like? Like, and how many on-calls on average does each resident have in the month?
So the on-call schedule, it depends, as I said, right? We try to maintain 8 or less residents in our hospital to make sure that each resident have enough exposure for the OR. So that depends. So if you have a higher volume, for sure, it's going to be having anywhere between 6 to 7 calls. If it's less, then you are going to be maxed out, but still you cannot have more than 9 calls per month. But I would say in average, I would say in the past few months, it's been 5 to 6 days per resident. We still maintain the junior and senior allocation. So that means, I don't know how different hospital in the kingdom, their on-call schedule, because in Canada, we didn't have that kind of allocation. We only had a resident on call and a staff attending on call. So there was no such thing as a junior or senior. In this hospital, still we maintain that. So we have a junior resident, a senior resident on call, and the staff, which is the attending physician, on call. So I guess that also give us some leeway, and we do have some senior registrar, specialist service, not resident service, I would say specialists that cover calls also. So it brings down the number of on calls, but it varies. But I would say an average 5 to 6 calls per month.
Awesome. Thank you so much, Doctora. That was really helpful and very thorough.
Okay. And I was just gonna, because I saw a question. Yes, so the IU fellowship is not purely for Saudi citizens. Non-Saudis are allowed and encouraged to apply. The only 2 things that they need to know: one, that their medical degree should be certified and should be acknowledged and recognized by the Ministry of Education if they had their medical school abroad. Okay. 2, they need to have the licensing exam from the Saudi, the SMLE, okay, and registered in the Saudi Commission for Health Specialty. Last thing, they have to have a sponsor for the financial expenses for the training. So these things are a requirement for the application, but being a Saudi citizen is not a requirement. And we had people from non-Saudis who graduated from that program.
Awesome, very clear. Do you guys have any other questions?
Someone mentioned, I think, if their CV is more about neurology than neurosurgery in terms of interest. I don't think it's a bad thing that you have a neurology instead of neurosurgery. As I said, this is a general advice, nothing to do with IU fellowship, I think with all kind of residency program. The more you show that you are aware what a neurosurgery program is and what it entails and the lifestyle of a neurosurgeon, the more the people will be keen to accept that resident. That being said, sometimes I do see people with a lot of neurosurgery rotations, elective rotations or internship rotations. But when I ask that resident in the interview, or from the recommendation, I don't see a commitment. I don't see an understanding of that, okay? And that actually, despite of that very fancy looking CV, might alter our decision as a committee, selection committee. So that goes the other way. So a resident who shows that there's a true interest in the neurosciences and have an awareness of what it takes to become a neurosurgeon and the pros and the cons also. We do acknowledge it's not an easy specialty in terms of the lifestyle of that specialty. Then we'll be more keen to accept that resident than someone who looks nice, but when you interview them, they don't have an understanding of that specialty. But I would strongly encourage people who are really truly interested to become neurosurgeons to do a neurosurgery clinical rotation, whether during your internship, after your graduation, and to do it in a center that are busy. Okay, to be more realistic. Okay, I think it really gives you an idea if this thing is your thing or not. Not just because of the lifestyle, but also, as I said, certain expectations in terms of your attitude and behavior. Residents who will show up late always to meetings, to rounds, to ORs. It's really disappointing, and for me, they don't understand what entails this residency. Two, people who are not really vigorous in studying, acquiring knowledge, staying late, taking care of patients, because it is a critical specialty. It does matter if you run the patient in the morning, at night, if you're on top of your game. These people can lose sight, they can lose mobility, they can lose consciousness, they can lose. It's really a tragedy when these things happen because of lack of commitment or lack of hard work. Okay, we all do mistakes. We acknowledge that. God knows I did mistakes, but it's different when you do a mistake. It's true mistake. That means you did your best. It was you did all you can do. You did try to acquire the knowledge, the practice, the rounding, but you missed something. It happens. But when it happens frequently or it happens because of negligence, it's really, really catastrophic for our patient population. So again, if this thing is not your thing or don't work well in stressful situations, you can't make decisions in certain situations, it's not a shame to say this is not my thing and I'll just try something else. And again, I always say there's great internist, dermatologist, cardiologist. They're not, it's just not like great physicians are not just neurosurgeons. They're great family doctors, and it matters if you have good doctors, family doctors or not. And you can tell once you start doing clinic in neurosurgery who's good and who's not.
الله يعطيك العافية دكتورة.
Allah yafikum. So sorry, I truly apologize. I was not aware that you guys were not hearing me. I hope at least you read the slides, so it gave you an idea. I know a lot of slides were just pictures, but I think the summary of that program is to know one, that we have two programs, as I mentioned. Two, that we are applying for accreditation from the Royal College of Surgeons in Canada. We already applied in March, and we're waiting for the response in May. And if we get a response that we are a candidate, we can have a visit in January 2027. And if we pass, then we'll be accredited. That means if you are part of our program, you can enter the Canadian exam, Royal College exam, by the end of your rotation. And if you pass, you will have the Canadian board. Last thing I wanted to mention, we are adapting because we've been working this in 2020 for the Royal College accreditation. We have what we call the competence by design model. You can Google it, go in. Even if you go to Royal College and Google it, it's basically the same thing we're adapting. So I don't want to أول على مشاعل. Dr. Machal. So that's why if you have any kind of questions, you can reach out to me by email. And I really apologize again that you were not able to hear me.
Allah يسعدك دكتورة. Thank you so much. We were actually able to hear you, alhamdulillah, until the last slide. فالحمدلله.
Oh, okay, good. Okay.
Allah يعطيك العافية. Thank you for
Okay.
listening.
No worries. Take care, guys.
You too. Have a great day. So next we will be moving to the southern region. So please join me in welcoming Dr. Abdulaziz Al-Ahmed, who will be speaking on the behalf of Dr. Abdul Khairi about the Aseer Central Hospital. Doctor, the floor is yours. تفضل.
السلام عليكم ورحمة الله وبركاته. حياكم الله جميعا. الله يحييكم يا رب. العذر والسموحة بس لأن اليوم أنا بقدم محل دكتور عبد الخيري بإذن الله بحكم انشغاله، فإن شاء الله نكون خير عون لكم على التعريف على مركزنا. بسم الله الرحمن الرحيم. كبداية سنترنا هو عبارة عن تجمع أسير الصحي اللي يجمع بين مستشفى أسير المركزي ومستشفى المحالل ومستشفى الولادة للأطفال عشان نغطي موضوع اللي هو البيدياتريك نيوروسيرجري. تمام. البروجرام بادي من 2015 تقريبا، خرج عدة دفعات. عدد اللي تخرجوا من تقريبا من 5 إلى 6 ريزيدنت. كبروجرام حنا عندنا 3 مقاعد سنويا. تمام. نقبل 3 ريزيدنت. إضافة على ذلك البروجرام نفسه كورك لود. عندنا يومين كرينيال داي، وعندنا 3 أيام سباين، علما بأن 3 أيام سباين هذه مفصولة. تمام. بحكم ان عندنا سباين ديبارتمنت. الله حق الفرصة كريزيدنت الفرصة في الاو ار حلوة، بحكم انه ما في سناير واجد. بادين من مستوى R1، أعلى مستوى الآن موجود R4. إذا دخلت الأو آر راح تاخذ فرصتك بشكل جميل. عندنا تقريبا كل التخصصات: فاسكولار، اندوفاسكولار، سكال بيز، وسباين، وبريفرال. مشكلتنا الله حق فقط في موضوع البيدياتريك نيوروسيرجري. الاكسبوجر يعتبر أو التعرض للحالات يعتبر جدا منخفض مقارنة بالسنوات الثانية. لكن في حاجة الله حق يعني تميز السنتر حقنا، اللي هو يعتبر ريفرال سنتر في المنطقة الجنوبية، بحيث إن احنا نستقبل الحالات من عسير كاملة، من نجران، ومن بيشة وضواحيها. تمام. بالنسبة حق الأكاديميك أكتيفيتي، الله حق ما كان اللي هو ممتاز جدا جدا بالسنين الماضية، لكن من هذه السنة تطور جدا موضوع الأكاديميك أكتيفيتي. إضافة على ذلك البروجرام بشكل عام خلال السنتين المنصرمتين الماضية تطور من نواحي عديدة، من ضمنها عدد الإنكولات انخفض بشكل جميل جدا الصراحة، بحكم أن صرت أنت قادر أنك تحضر حالتك اللي أنت بتدخلها لو آر، وفي نفس الوقت أنك تذاكر، وفي نفس الوقت أنك أنت تكون فاهم على الحالة اللي أنت داخل فيها. الأرقام المجنونة 9 و10 و8 إنكولات الله حق خفت. صار الماكسيموم عندنا 7، وتيلرد على موضوع عدد الريزيدنت. تمام. وايضا من ناحيه الاوتسايد روتيشنز، الاوتسايد روتيشنز اللي هو غالبا يعني السنتر كسنتر هو مكتفي بنفسه، تقدر تشوف كل شيء ما عدا زي ما قلت لكم البيدياتريك، وموضوع اللي هو الفانكشنال نيوروسيرجري. الله حق هذا اللي مو موجود عندنا. حتى موضوع الاندوفاسكولار از سب سبيشاليتي مع وصول دكتور رضوان تكروني اللي هو امريكان بورد سيرتيفايد، الصراحه صرنا ناخذ فرصتنا اكثر. يعني انت R3 ولا R2 راح تحط يدك في هالحالات اللي ما يحط يده فيها الا F1 ولا F2. فاذا كان في ميزه عليا تطغى في سنترنا الصراحه موضوع فرصه الأو آر. يعني هذا الكلام اللي انت توصل R5 R6 وحدك سكشن، حدك تسوي دريسنج، حدك تسوي بري راوند، بوست راوند. حنا هذه البري بروسيجرال ثينكس ما نسوي لها تقليل من قدرها، لكن ايضا الواحد الصراحه جايع وخاطره انه يشتغل، وهذه الصراحه ميزه في سنترنا، انك تحط يدك في الالكتيف كيس عطفا على رزقك اللي يجيك في الانكولات. وإضافة على ذلك يعني سنترنا الصراحة سنتر ما هو السنتر البيرفكت، لا عيوبه. من ضمن عيوبه نفس ما قلت لكم موضوع البيدياتريك، موضوع بعده، موضوع الصراحة عشان نقدر الآن في خلال هالفترة نوفق على موضوع عدد الانكولات قد ما نقدر. قاعدين نحاول هالفترة ان احنا ما نطلع ناس واجد اوتسايد روتيشن في حال ان الريزيدنت كان موجود عندنا. بس والله اللي عنده سؤال عنده استفسار يقدر يسأل عادي، ما عندكم مشكلة.
الله يعطيك العافية دكتور. Guys, اللي عنده أي أسئلة, if you have any questions, please just drop everything down in the chat box. دكتور what about the research opportunities بالسنتر حقكم؟
الله حق الفرص البحثية تعتبر فرص جميلة، يعني عندنا الداتا جدا جدا كثيرة، وأنا يعني أنا جيت الصراحة وكنت من الناس اللي انترستد في موضوع البحث العلمي من البداية، فأيضا من هذا الموضوع أنا لقيت فرصتي فيه الصراحة. حالات كثيرة، حتى موضوع الرير كيسز موجودة. فموضوع البحث العلمي حرفيا أنت موجود لحالك، يمديك تسوي كل شيء، سواء أكاديميا، سواء من ناحية الشغل، وسواء من البحث العلمي.
ممتاز. طب لو في نصيحة ممكن نقدمها لطلاب الطب اللي إن شاء الله بيكونوا مقدمين على برنامجكم، إيش بتكون هي؟
والله النصيحة أن قبل أنت ما تقدم على نيورو سيرجري، أنا والله من الناس اللي اتبعت نصيحة اللي هو دكتور حسام الجهني. خيار النيورو سيرجري المفروض ما يكون خيارك الوحيد، يكون خيارك الأوحد. تمام، بحيث أن أنت المفروض حتى لو تكون بتفكر في other specialties، لازم تكون أنت مختار النيورو سيرجري وأنت متأكد أن هذا الخيار اللي انت تبي تعيش اياه 30 40 سنه قدام، بحيث انك تكثر من روتيشناته، تروح وتجي، تفكر فيه عادي. ترى احنا يعني احنا مو بسباق، مو بسباق يعني ان انت لازم تنقبل هذه السنه. عادي حتى لو تعطيها فرصه انك تسرفس سنه، تاخذ اتاتشمنت فيه قبل ما تختاره. الله حق من ناحيه التخصص، هو تخصص يعتبر منهك ومتعب، لكن في نفس الوقت جميل. تمام، يعني انت الصراحة راح تتعامل مع اكثر شيء انترستنج في جسم الانسان اللي هو المخ، لكن في نفس الوقت هذه لها ضريبتها من ناحية التعب، من ناحية موضوع التحصيل العلمي، حتى موضوع لما انت تقارن نفسك بالاذر السيرجيكال سبيشاليتيز. في ناس يدخل النيورو سيرجري يفكرها انها مهارة يد، اي هي مهارة في اليد ايضا نيورو سيرجري، لكن نيورو سيرجري من التخصصات الجراحية اللي قد يكون هو الوحيد اللي متفرد في موضوع انه ما يمشي بالخبرة قد ما انه يمشي بالعلم. فأيضا انت حط في بالك هذا الشيء، انك راح تقرأ كثير كثير كثير، ازيد من خويك الاورثو، ازيد من خويك اليورو، ازيد من خويك الجي اس. فهذه من الاشياء اللي انت لازم تحط لها اعتبار يعني.
طيب في سؤال هنا، واحد يقول لو أنا شخص interested بالنيوروساينسز والنيوروسيرجري، هل بيكون شيء كويس إن أضيف أشياء نيورولوجي تحديدا أكثر على السي في حقي كطالب، ولا ممكن يأثر على المقابلة بعدين؟
على حسب. انا من الناس اللي سويتها. يوم جيت اسوي السي في حقي، انا كنت انترستد في النيورو ساينس، لكن انت بعد لازم تجيبها بلفه وانت بتقدم البحث. مثلا تكلم عن البروبابيلتي حق السبستانشن ياجرا اكتيفيشن، ولا الستم سيلز حقتها عشان تو كاونتر اكت الباركنسون ديزيز. تتكلم عن الانسولار كورتكس وتتكلم عن الاشياء يعني. انت جيبها، لكن في نفس الوقت ميكست مع النيورو سيرجن، لا تكون كذا بيور نيورولوجي. النيورو ساينس انا بشكل عام اشوفه مقبول، لكن بيور النيورولوجي لا، حاول انك تربطها مع النيورو سيرجن، مثلا الابيليبسي والفوكايز واللي هو البروسبكتيف ستاديز، اني الناس اللي استفادت على الابيليبسي سيرجريز والليبكتوميز وهالشغلات كذا تصير مقبوله شويه. ربعنا ستريكت ترى في موضوع البحث العلمي، يمكن انت لو مسرفس ولو انك مشتغل على نفسك من كورسات ومن ذا الامور راح يقدرون هذا الموضوع، لكن موضوع البحث العلمي لا، يحبونه يكون مور سبيسيفيك على النيورو سيرجري، او يكون ريليتد حق النيورو سيرجري.
تمام. في شخص كمان سأل إيش السناتر اللي لها علاقة بالبروجرام حقكم، يعني إيش المستشفيات اللي الواحد بيكون بيتدرب فيها لو كان في العسير سنترال هوسبيتال، وهل عادي الطبيب المقيم يطلع برا الروتيشنز بتخصصات ثانية أو سبيشالتيز ثانية، ولا ما تسمحون؟
الحين حاليا حنا مستشفى عسير المركزي ومستشفى أبها للولادة والأطفال. تو خالص عندنا أيضا مستشفى كبير اللي هو مستشفى خميس مشيط المركزي، في خطة من التجمع أن يكون التحول عليه، فأيضا بنرتبط بمستشفى خميس مشيط نفسه، وأيضا في خطة أن نكون حنا مع العسكري. من ناحية الأوتسايد روتيشن، يعني السناتر الحالية أو المستشفيات اللي داخل سنترنا حاليا هو مستشفى عسير المركزي ومستشفى أبها للولادة والأطفال. الاوتسايد روتيشن نفس ما قلت لكم الصراحه، يعني هي ليميتد، تكون فقط للسينيور ريزيدنت، لان از براكتس از نيورو سيرجري انت راح تشوف كل شيء في عسير المركزي، اضافه على ان احنا الله حق يعني شغالين كل شيء from the highest. endovascular راح تشوف AVM mobilization fistula mobilization. vascular راح تشوف الكليبنج، راح تشوف الاي في ام. اونكولوجي راح تشوف من الكونفكسيتي مننجيوما لين الكوردوما لين البتروكلايفال مننجيوما. كل شيء راح تشوفه هاي سباين، راح تشوف السكوليوسس وراح تشوف الكايفوسكوليوسس وراح تشوف التيلف وهذه الامور. لكن as better exposure and for يعني other experiences راح تكون غالبا allowed من الليفل of R5 R6 عشان الواحد يعرف هو ايش يبي ويشوف الاشياء اللي ما شافها، زي ما قلت لكم مثل البيدياتريك ومثل الفانكشنال.
ممتاز، الله يعطيك ألف عافية دكتور، شكرا على وقتك، الله يعطيك العافية.
وابدا اللي محتاج شيء، اللي عنده سؤال، اللي في خاطره شيء على موضوع سنترنا، ابد لا يردكم الا لسانكم. وابد اللي له خاطر في حاجه ياخذ رقمي ويتواصل وياي دايركت على الواتساب، ابدا لا يهمكم حاجه.
الله يكتب أجرك، شكرا دكتور.
الله يعافيكم، في امان الله ان شاء الله.
So thank you all for joining. This wraps up the first day of the virtual open house. We can't wait to welcome you again tomorrow, inshallah ta'ala, at 2 p.m. Have a wonderful rest of your day. مع السلامة. Assalamu alaikum and good afternoon, everyone. We hope you're all having a wonderful day so far. My name is PSMMC Sido. I'm the head of the logistics and organization team, and I'm joined here with my co-head Ragad Limtayri. On the behalf of the Saudi Association of Neurological Surgery Medical Students Chapter, it is my pleasure to welcome you to the second day of the first Saudi Neurosurgery Virtual Open House. At SANS MSC, our mission is to enhance the academic and professional experience of medical students and interns across the kingdom and to support them in exploring and pursuing careers in neurosurgery. This initiative brings together neurosurgery programs directors from across the Kingdom of Saudi Arabia to provide valuable insights into residency sessions, into residency training, and guide aspiring neurosurgeons in their journey. Each session, inshallah, will offer an overview of the program structure, the clinical exposure, the research opportunities, and what to expect from training and residence life. We are truly honored by the support and the participation of the program directors from across the kingdom, and we hope this initiative will benefit you, inshallah. Please keep in mind that we will have a 5 minutes Q&A segment after each presentation, so hold on to your questions till that section, inshallah, and we look forward to having a productive and engaging program with you all. So our program today will be covering multiple programs in Jeddah region, and starting off, please join me in welcoming Dr. Afnan Al-Khutani, the Program Director at King Faisal Specialist Hospital and Research Center in Jeddah. تفضل دكتورة.
أهلا وسهلا. Thank you so much for the introduction and your time and presence. Inshallah, it's a very casual talk. I remember before joining this neurosurgery program, I had something similar was held in KFSH Saudi Commission building in Riyadh. And I went there, like I booked a ticket and I went there with Dr. Prof. Yamani and all of respectful doctors at that time, Dr. Larry, Prof. Yamani, and others. So it's a true pleasure for me now to present our part. I hear an echo. Okay, so let me share my desktop. Okay. So do you see my desktop now? Or
Yes,
I still
yeah, we can. بس please make it full screen.
okay طيب. حاضر. Okay, this is what you're seeing now, my
Yes,
presentation.
perfect.
طيب,
الله
it's Allah يعافيكم يا رب. طيب, it's a very casual talk. I just wanted to highlight the certain points like the journey of neurosurgical residency, our center, what it is special in, and the availability of other subspecialty in our center. So residency in neurosurgery at King Faisal Specialist Hospital, Jeddah, has been there for a couple of years. I've been one of the graduates from that program. Since I joined, we are still till the moment we're joint program where residents can rotate in outside hospitals and even they can also do some training in outside facilities out of the region like Riyadh or Eastern Province. I have done one elective in Canada, but it was very arranged and monitored by that time. Now there are some restrictions in this regard, but I think we're quite flexible. If we are willing to get this resident back, we'll give him full support. So for the neurosurgery, I think whoever is thinking about neurosurgery is already knows about the neurosurgery. For instance, if we reach the interview level with a candidate who has never been experiencing a neurosurgery, this is very red flag to us. Why is that? Because the specialty is very demanding. The commitment level is extremely crazy and responsibilities are very heavy. And excellence is very difficult to be achieved. You can pay too much effort and you become only normal or standard. If you want to be like super standard or like very unique, it's very hard to achieve that with the minimal requirements. So neurosurgery to start with is a very heavy specialty. But in our region, somehow there is a positive way to think about it when it comes to neurosurgery residency in Saudi Arabia, where the duration is 6 years, but it's within the country, your country or your hometown usually. It covers the brain, spine, and peripheral nerves. And also highly demanding, and on the other hand, it's very rewarding specialty. For the first few years, it's foundation year, like from R1 to R3. I know in other residencies, R3 is senior, but like in neurosurgery, it's intermediate, 3 to 4, intermediate. 5 to 6, those are advanced autonomous surgeon, where they can take decisions, they can open OR, they can take second calls, etc. For the rotations, they can do some rotations for very specific subspecialties that are not available. Talking about King Faisal Specialist Hospital, we always send the junior residents for rotations in trauma centers, because in King Faisal we don't accept trauma cases. So this is like a lack in our program. So we have to fulfill it with external rotation, either in King Faisal, King Fahad General Hospital, or the National Guard Hospital as well. So they cover the trauma part. For the competencies, we were following the CAN-MED framework, where the medical, where the graduate will be graduated with, inshallah, best skills in medical expert, communication, leadership, scholarship, and professionalism. So talking about King Faisal specifically, it is a tertiary care center. We're receiving cases that are usually quite difficult to be performed outside. So it's quite, the volume is quite high, and the turnover is very, very fast. The exposure to complex cases is crazy. I think even the simple cases like subdural hematoma evacuation, VP shunt insertion, it always comes in a very sick group of patients, like leukemia patients with very low platelet, or end-stage cancer patients, or end-stage renal disease, liver cirrhosis with coagulation, coagulopathy. So whenever the case is straightforward, this is a blessing, but most of our cases are very complex cases. But on the other hand, we're having very good alhamdulillah support من ناحية التكنولوجي sub-specialized يعني work. We have almost all the sub-specialties. My specialty is functional epilepsy and pain, with all of the neuromodulation and robotic type of surgeries. I do them. The skull base and vascular, endovascular, my colleague, Dr. Muhammad Arif. Also, he had very good training with the hybrid training, I mean, for the open and endovascular techniques and also complex skull base. Prof. Saleh, Dr. Muhammad Hamoud is doing a pediatric portion of the neurosurgery. Also, he's doing spine surgeries. Dr. Muhammad bin Mahfouz is skull base, but he's doing almost everything, like a general neurosurgery, as well as Prof. Saleh Baisa, his fellowship in pediatric and spine, but he's doing also everything. So the earlier generations, they were doing general neurosurgery, but they're not doing مثلا my functional cases. They're not doing DBS. They're not doing stereo EEG, robotic neuromodulation. They're not doing that. They're only like doing the general part of neurosurgery, tumors, skull-based, complex ones. The newer training is directed more toward the subspecialized. So we're expecting also another spine surgeon. He's joining us in June, inshallah, Dr. Anas Bardisi. And also we're planning to send one of our younger colleagues for pediatric fellowship in order to just fulfill or replace the people who are leaving soon, inshallah, ala khair. Yeah. For the neurosurgery, طبعا in the high school, you have to perform your best, and then the pre-med, if there is a pre-med in your college. After that, for the medical school, I think the decision usually been taken in medical school. If you're interested in neuroscience block and you get exposed to the hospital, to the operating rooms, here where the passion starts. So in the medical school, what I advise people is to join the neurosurgery theater, go into the world of the neuroscience and talk to people, because you really need a good time and exposure and people to know you, to trust you later on. Beside good performance on papers, because nobody can be convinced that you're good unless you show them evidence. Okay? Then the internship, you should plan your internship to pass by neurosurgery rotations earlier before the interviews. Number one, people get to know you, to take some recommendations. Also, you should test the environment that you will spend your residency in, because like the neurosurgery residency is not a short time. Like 6 years is a very long time. So you test the environment, you see the hospital qualification, the hospital potential, whether they can send you for fellowship or not. And if there is مثلا more than one seat or less than that, if there is مثلا seat this year or no, all of those things you will know during internship by getting closer to the to the hospital you're planning to join. And do your best. Always do presentations. Attend operating rooms. Don't stay silent. This is your time to show off all of your potentials and be as authentic as possible. For the residency, as I told you before, it's 6 years, and it's quite tough time of your life. Some people outside, they do PhD as a part of their residency. They freeze for 2 to 4 years, and then they come back for to finish their residency. Whether this is a good plan or not, it doesn't apply on the Saudi board. So for the Saudi board, the residency is one shot, like 6 years, continuous and consecutive. After the residency, usually people join a fellowship for subspecialty. Otherwise, without a fellowship, in 3 years, you can join any program, any hospital as a general neurosurgeon by practice only. But ideally, is you're being sent for a fellowship, whether it's North America or European or Australian. You should also like look at this during the application, because each country has different ranking in the Saudi Commission of Health Specialty. Usually the North American ones are highest in the ranking, and European and Australian are less than that. So for the learning environment, yes, we have academic sessions. Actually, weekly, we do have like dedicated for the residents. In King Faisal, we do the morning grand round every Tuesday. We review all the cases, and we allow the residents to present, and we go over every case, and we do some burning questions and discussions. After that, we have the radiology meeting where we meet with the neuroscience department, including neurology, psychiatry, adult and pediatric neurology, with the adult and pediatric psychiatry, and the neurosurgery, all of us. With the neuro-oncology, so we go through all the cases or weird cases, and we discuss them in depth with the radiology overview. This is every Tuesday, and after that, also on Tuesday, we have 2 hours of education for the resident. 1 hour for presentation, 2 short presentations, and 1 hour for discussion and elaboration by the consultants, depending on the specialty. For example, مثلا, if the presentation about regimen neurology and مثلا rhizotomies or MVDs. So the first part, the theoretical part, will be covered by juniors. The surgical approaches will be covered by seniors. And then the consultant, مثلا أفنان خوتاني, is functional and pain. She will talk about this part, and we can sometimes alternate not only lectures. We can pull up some recent papers, so we go through them as discussion, as the literature review and journal club kind of. So according to the availability of the lectures, usually we do this on the second 2 hours. After that, we have 1 hour of SEG planning. This is for also Tuesday. It's a quick meeting for robotic surgeries. And on Thursday, we have the official epilepsy conference meeting, also 1 hour from 12 to 1. In between clinics, we go through the epilepsy cases that needs surgical decisions. Also on Wednesday, we have tumor board where the residents present the cases, and it's a business work mainly. So we take decisions on each case, whether to go for surgery or a specific kind of chemo protocol, radiation, whether to be enrolled in trials or something. So this is the area where we pour all the cases to get them divided into the most appropriate service. So all of us as colleagues, neurosurgeons and neuroradiologists, neuro-oncologists, as well, medical oncologists, as mean the neuro ones, as well as the radiation oncologists, adults and peds, we all gather and we discuss those cases. It's very beneficial. It's not every week, it's every other week for the neuro-oncology board. For the assessment, طبعا we have the continuous evaluation every 3 months or every quarter, and we have the logbook where the people collect their cases, and DOBS that is being sent to our evaluation system, and we prove it. And then we have the ITER. For ITER, it's for the more senior ones, to pass this level to the next level above. Usually it's for the seniors. For the juniors, they have part 1 and part 2. Part 2 is like the final exam. Part 1 is their first exam. Like you don't finish your first few years in residency before finishing the part 1. So this is in general. We do have annually the clinical exams for the resident. It wasn't applied during my residency, but currently it's official. Sometimes we make it only as mock. Sometimes we don't count them as يعني pass or failure, but if the resident does well and he needs some push, this clinical exam can help him a lot. So yeah, choosing neurosurgery, I would like to hear from you, يعني if you have specific questions about this specialty. For me, I don't think it's the best job in the world, but for Asnan al-Khotani, if I was given the chance to choose something else in other life, I would have been choosing the same because I believe I've done some good stuff to a lot of my patients. Alhamdulillah, I've changed like certain points in their life. Inshallah, يعني, I always remember that good part about neurosurgery. There is always a sad part where there are like tumors that you can't battle or you can't win a battle against them, but still you keep in mind you're doing your best, but we're only human being. So yeah. For the qualities and the skills, I think neurosurgery is a very wide specialty, and there are a lot of entities. If you're thinking about vascular, it's totally different than functional, for example. Functional is more of elective, intellectual thinking, planning over softwares and computers, and very meticulous work, repeated the same way every time inside surgery. So vascular is very surprising, acute, and it's more critical and doesn't have enough time to wait or do any more planning or intellectual thinking. So I think everyone can monitor himself during the residency and see whether he fits more with functional or with the oncology or vascular or spine or whatsoever. For me, the spine, I think my feeling toward the spine was quite mixed because I love the science of the spine surgeries, but my hand is very tiny, and holding the kerrison was stretching my hand in a very painful way. So it was not my preferred subject, but I used to have very small one only kerrison inside the King Faisal OR. I use it every time I utilize the kerrison. So it's not impossible to do spine surgery with my tiny hands, but it's quite painful to me. Who should consider neurosurgery? I think طبعا first of all, being realistic is the qualities, your qualifications, like collect your points, do your homework, and bring an evidence that you fit into neurosurgery. Do well in your rotation, have a good reputation. Okay. After that, the real interest is being shown by showing up. But you can't tell somebody that you're interested in neurosurgery, but you've never been into a neurosurgical OR or you have never been taking any on-call in neurosurgery. طبعا attitude is the most important thing in life, honestly, not only neurosurgery. If you want to do anything in life, you have to be really, you have to do very good attitude. For the dedication is a must. يعني dedication, resilience, and passion. Those are the fire or cornerstone in neurosurgery. You can't excel without a real dedication, without being resilient, and you're dealing with a lot of people with, even if they were not literally type A personality, but being in the very stressful situation brings the worst out of people sometimes. So being resilient, easygoing, and يعني you improve your stamina with time, passionate about your work. Every time you find a reason to wake up and do the same work with even more and more surprises. So this is very crucial for being successful in neurosurgery. Exploring your own interest and strength will determine if neurosurgery aligns with your aspiration or not. And as I told you before, it has a lot of subspecialties. So you can do peripheral nerve, you can do more like refined work rather than the spine or tumors or whatsoever. So, okay. For the educational journey and requirements, I think generally you do your best in choosing the center you're joining. This is the first step. Choose the people that you want to work with. It makes a lot of difference when you're working with a very a friendly atmosphere than a toxic one. As I told you before, neurosurgery brings the worst out of people during the stressful situation, but still, seeing some centers in comparison to other centers, you just judge according to your or build your own expectation according to your experience, not according to people talk. About neurosurgery, stories. I have a lot of stories. I don't know which one to pick, but of course, everybody in neurosurgery, we're facing a lot. Like we're doing like surgery that changes people's life. And the one that I'm showing something here similar to one of the cases where she had left-sided, not exactly this patient, other patient, but similar idea. A patient with the groin pain, and on MRI, it's MRI negative. So she was young child, and till she became 19, she came to me. She was having intractable seizures. Her seizure semiology is groin pain with intense pleasure. So after that, the workup, she went through MRI, AEG, PET scan, everything was negative, negative, negative. But the EEG is showing left frontal. Left frontal is quite big area, and it has important speech function. It has movement. It has SMA premotor. So it's very risky place to go and fish. So the plan was to go for invasive recording, and we went with SEG. We implanted there. We were able to capture the seizure focus, and we also did the stimulation, and we were able to induce her seizures. And she was recorded over a video for seizure, and she was like shying out because of this growing feeling thing. And after surgery, her seizure, alhamdulillah, was completely gone. She had angel class 1 upon the last visit. MashaAllah, she stopped her medications, and this was like a life-changing to her. I always remember consenting her for surgery. I was telling her that you can wake up because it was quite like at superior frontal gyrus and middle frontal. So I consented her that she would wake up probably with some weakness in the right side, upper lower limb equally, as well as loss of speech, because we are very close to the SMA premotor. And I told her that this might be very temporary, but we cannot guarantee when it will come back. So it was very tough call to her, or tough decision to agree on doing a surgery that she would lose her ability to talk, walk, or move her hands. But despite that, she underwent the surgery, alhamdulillah, successfully. Her speech regained back after a few days, and she is fully mobilized after before her discharge. So I think epilepsy surgery is very life-changing surgery. But this applies on all other specialties, طبعا tumors and everything. I might be biased because we're using this. For the people who likes the technology, neurosurgery is the specialty that has the most advanced technology, because our work is very complex, and we always need to double check ourselves and use extra expensive device to improve the accuracy and efficiency as well in time and targets. So yeah, as I told you, I'm not biased, but King Faisal Specialist Hospital in general and Jeddah branch in specific. We have a very advanced subspecialties. People are going into their core for their specialties. We're doing very specific researches. Even the research is nobody interacts with the other, so the functional are doing their functional, the spine are doing their spine, with the whole group, مثلا functional with the movement disorders, the epilepsy people, the spine with their مثلا sorry PT or OT with them. It's very sub-specialized center. For the mentorship, inshallah, نكون عند حسن ظنكم. We always like to stay as close as possible with our residents. Every quarter, we gather socially outside the hospital, and we listen from the residents about their difficulties in this rotation, any areas to improve, any surgeries that they did not get enough exposure. And believe me, we have changed a lot from those simple meetings outside. It builds rapport as well as it gives it gives a very relaxing atmosphere for the resident to talk about their desires in the rotation. So for the national and international exposure, alhamdulillah, every double ANS we always have papers there. For the CNS, we had papers, but I couldn't make it because it was interlapping with the American Epilepsy Society. So American Epilepsy Society in December, we always have a lot of papers in epilepsy. For the neurosurgical ones, the Congress of Neurosurgery, CNS, as well as American Association of Neurosurgery, AANS. All of us, we always apply. And last year, mashallah, I think we had 6 papers from our center, and I had a presentation with the epilepsy group, and it was like really amazing, mashallah, presence from King Faisal. We're 5 consultants here in King Faisal. 4 of us were attending there with our residents and our medical students as well, mashallah, tabarakallah. Why this matters to you as future neurosurgery? I think neurosurgery, you're thinking now about open neurosurgery, about doing resections and craniotomies, but I think more and more you get advanced in the career. The neurosurgery is shifting more toward multidisciplinary collaboration, advanced technology, like more robotics, more tiny stuff like nanotechnology, AI-based, 3D imagination for the 3D imaging. More and more advances are coming up in the neurosurgery, as well as the genetic targeted therapy, like for epilepsy, for some other neurological disorders. So this is very promising. Is it life-changing? For now, yes, it is life-changing specialty, but with certain losses or high price. But still, I think there is a huge area of improvement, like with the focused ultrasound, without any invasiveness to the skull, with endovascular techniques, with the laser anesthesia thermal therapy. All of those technologies are very new tools that can change the game in neurosurgery. I think we're coming very soon to an era where the neurosurgery will become more and more less invasive as of now. طيب, I hope that we're helping in building up some good neurosurgeons that we can rely on in the near future, innovators, leaders in their field. Also, we want you to balance your life as much as possible. We always give like some hints to the residents, like for instance, from the advices that we used to give is that don't eat inside the hospital. You can drink coffee, but don't eat. So you finish your work quickly and you go home and you eat your lunch with your family. This is like one of the ideas to just encourage the people to live as much as possible from a balanced or good quality of life. So I think that's all what I wanted to say, and sorry if that was like boring lecturing. I would love to hear from you. Nasser Al-Ahmari, I'm very interested in neuroscience and wish to have summer training. King Faisal doctor can guide me and my colleagues about هذا. Yeah, of course. And I left my email here. This email is not very clear. I'll put the other email that I always receive the request on it. So Afnan at Fellowship. Let me just make it in brighter color. Afwan. So always feel free to reach me out. Yes, and you're always welcome. I've met a lot of residents, like for 3 generations now. One is our intern, and 2 others where we know them since being our medical students. So they're always, mashallah, يعني, showing up. They're interested. We know them even before they come to the interview. So the summer training is very helpful. Summer training and the initiation of paper, مثلا systematic review, data collection, whatever comes to your mind, we're very welcoming. Me and Dr. Muhammad Arif also is welcoming person, so you can reach out to any of us, and we're always welcoming the students to join our club. Apply for training. Yeah, بس يعني هو the problem is that we cannot accommodate a very, very large number, but we know that during summer, we're trying our best to accept as much as possible because it's limited time to you. Do residents from King Faisal especially typically pursue their fellowships abroad? If so, how accessible are their opportunity and what kind of support? What kind of support does the program provide? I'm talking about my personal experience. I was sent from King Faisal Specialist Hospital to Toronto, University of Toronto, UFT. I was really, alhamdulillah, supported. Before that, I had my elective in Canada, London, Ontario. At that time, there was some problems with evaluation. They did for me an evaluation, and then they did not accept it because the training evaluator was not from the Saudi board. So I had to do another evaluation from King Faisal Hospital. Dr. Muhammad bin Mahfoud and Prof. Zain Al-Abdin Janjoum, Allah yarhamu. Kindly, they both have signed me another evaluation for my elective in London, Ontario. After that, for my fellowship, I personally was supported, but I was the very first graduate who was sent abroad and came back. So they did my papers, alhamdulillah. I can't remember the obstacles, but like it took me like a few months, and I joined right away after my residency. After I finished my residency, yeah. Like I finished by December, and I joined here in March. So I was not delayed a lot. For the current resident, they do have some delay just because of the opening for the lines and those things. But يعني, usually we do fight for our graduates to get them back in our place, unless يعني, the graduate themselves was not, or herself was not showing مثلا interest to come back, or they did not perform well, or they had some like attitude issues or something. But generally we're trying our best to get them back. والله يعني I don't remember that we have pushed anyone away. We always try our best. بس إذا ما كان في availability like for the lines reason, or for the يعني مثلا the occupational يعني أو other administrative availability, ساعتها it's out of our hands. To question, how can the academic performance affect the acceptance even if the applicant proved his or her strength, the interest? Advice to have powerful application file. Yeah, شوف هو في neurosurgery you always have to do your best. يعني إذا كان مثلا من درجات you have to get the highest درجات. If you want to get مثلا evaluation مو evaluation عفوا recommendation, get extra very strong specific personally tailored reference letter. لازم تكون بالاسم، ومثلا لو directed مثلا from مثلا let's say دكتور خالد عرابي to دكتور أفنان الخوتاني, this medical student or this intern has rotated with me and he's very good. أو إنه he call and he makes some like verbal recommendation. This is a very good student or very good intern. I would advise you to give him a chance. I would recommend him مثلا for any program or whatever. يعني هذه أشياء يعني you go beyond and extra mile على أساس إنه تسووا هذه الأشياء كلها. إيش هذا عفوا. What do you the lectures? Thank you. What do you look for in a CV as RTB? شوف honestly speaking the CV يعني أنا I see it the night before. I كده screen it. الأشياء اللي مثلا تعجبني I highlight over it. ويوم الانترفيو أسأل الريزيدنت عنها مثلا إنه هذا الاستدي اللي عملتها ومدري إيش كان الرول حقك فيها وكده. قال لي مثلا عملت داتا كولكشن. قال لي مثلا I write a manuscript. مثلا واحد لا أنا I did it from A to Z. ولا واحدة قالت ما حد اشتغل غيري أنا وأنا سويتها كلها. فأقوم أسألها أكثر طب what was your interpretation إيش الريزولت ومدري إيه. واحدة قالت لي مثلا عملتها presentation في السانس meeting. فأقول لها طيب قولي لي إيش الميثودولوجيا اللي استخدمتوها وكيف قارنتوا زي كذا. أكيد حتكون مرة فاهمة وكذا. فأي حاجة أنت ماسكها في أنت أو أنت ذاكرها في السي في لازم تراجعوها بنفسكم عشان غالبا تنسألوا فيها. أو إنه نفتح مواضيع بيرسونال كده مو بيرسونال يعني جنرال كده about life مثلا your hobbies. أشياء إنه تعرف لما إحنا we want to find a good friend for us غالبا هذا هو الاتموسفير حق ال الانترفيو حقنا في كينج فيصل سبيشالست هوسبيتال. كلنا تلاقينا نبغى ندور عن a future friend أكثر من أحد يعني نيردي وزي كده. فأحد easy going ما عنده passive aggressive behavior. نشوف إنه مثلا easy going ممكن يستحمل ممكن يعني العمل معاه ما في له تنشن ما في له اللي يعني يقبل وفجأة ينفجر وزي كده. فيعني في كده certain كده behavior تبين إنه هذا الإنسان is a nice person to work with ولا لا. هذه رقم واحد. رقم اثنين طبعا qualification. نشوف درجاته مرة تكون كويسة. نشوف مثلا جامعته كمان مرة تكون قوية ومحترمة. الGPA حقه يكون مرة عالي. كل هذه الأشياء مهمة. في النهاية الإنسان اللي اشتغل على نفسه هيكون عنده درجات. اللي مثلا ما عنده درجات وكده لازم يسوي مرة زيادة عشان يشتغل على نفسه to overcome هذه الويكنسز حقته. والريسيرش طبعا احنا كل ما نشتغل معاكم ريسيرشز نعرفكم أكثر. Is it true that neurosurgery has such a tiring lifestyle that it only fits people who are anti-social? هذا correct? Does applying in neurosurgery summer elective require certain criteria? apply early. احنا عندنا كتخصص عندنا لينك للسمر elective application. فابلاي as early as possible. تتواصلوا مع سكرتيرة دانيا ان شاء الله. لو ارسلتوا لي ايميل انا ارسل لكم تفاصيلها وانتوا تتواصلوا معاها وتقولوا لها. الديدلاين ما اعرف هو variable from year to year. بالنسبة لي neurosurgery lifestyle is it tiring؟ ايوه طبعا it's very very hectic. ويعني you can make it less hectic by working مثلا only in governmental hospital. بس with time I think يعني أنا what happened with me إنه I started to feel bored with the repeated cases and routine because I have plus 1 day OR, 2 days of the clinics and that's it. So 3 days per week and in between I only do like administrative work, residence meeting, teaching كده. I started to join هذا other hospital like for a private practice and it's nice. I see other cases like traumas, general neurosurgery, but it's nice. Whether this is hectic lifestyle, yes, it is, but it is rewarding for me. I enjoy doing it. I find myself more accessible to other people that cannot join King Faisal. So it's an easy access to screen the patients before bring them here. It's something that I love to do. So I think for me, whether I'm anti-social or not, I'm not sure, but I enjoy social events. At the same time, I finish everything very quickly and I'm very fast in general, so I finish my work very quickly and go home. I finish my homework very quickly and go to the gym. So I'm kind of يعني trying to organize my life around my work. يعني I live beside the hospital. My gym, my son's school is very close by. But I think utilize all of your resources to make your life easier. يعني مثلا bring yourself a driver, or if you drive يعني make your life as easy as possible. Bring nanny for sure for your son if you have like a lot of kids, mashallah. It doesn't interfere, but you can always يعني balance somehow. يعني مثلا ممكن تدفعي أكثر or you pay more على أشياء على ناس يخدموكي بس إنه حياتك تتحسن. I think this is very doable. بالنسبة للبنات كمان حكاية المرج والخلفة وزي كده. Does it interfere? No, it doesn't interfere with the neurosurgery life. I've been working while being pregnant. I've done also my elective وأنا كنت pregnant و I wasn't I didn't know that I was pregnant. So يعني it's all possible. And I've gone through this road before, and I'm telling you it's very possible. طبعا not easy, not without sacrifices, but it's very possible. وإن شاء الله you're even يعني في هذه الفترة من الحياة everything is much easier. فإن شاء الله إنه تكون أسهل بإذن الله عليكم. Do you have a research fellowship? لا, research fellowship per se no. لأنه ما عندنا wet lab ولا مثلا research lab research fellowship. بس أعرف ناس برا يسووا research fellowship زي مثلا دكتورة في مايو كلينيك دكتور جاليرين زاده، وفي ناس في تورونتو، وفي أماكن كثيرة يسووا طبعا research fellowship. For the students who want to يعني if you want, if you're interested, I can مثلا connect you with other people or direct you to other people that does this research fellowship. بس أنا لا، في التخصصي ما نسوي للأسف a research fellowship. إن شاء الله in the near future. For students who want to get knowledge, not the experience in the summer training, is it fine to have a training in neurology even while I'm interested? Of course طبعا. يعني بالنسبة للنيورولوجي هم يعني أهل الساينس ما شاء الله. They talk, they think, they localize, examination حقهم is amazing, localization من examination. أنا I do a lot of meetings معاهم. أنا نسيت أقول لكم إنه كمان عندنا DBS meeting once one day every month على ال deep brain stimulators. جميع الحالات بنركب لهم DBS ونشوف هم غالبا باركنسون، موفمنت ديسوردرز اللي هي زي التريمور، ديستونيا، زي كذا. هدول نجمعهم ونتناقش فيهم. فلازم يكون عندي يعني أنا my right hand البيشنت سelection غالبا أعتمد فيه كثير على النيورولوجي. So our يعني big respect ل our colleagues في النيورولوجي سواء movement disorders, epilepsy. طبعا حقون الفاسكولار يتعاملوا مع الستروكولوجيست دائما. فيعني كلهم والله، حتى حقون الاوتو اميون سوري النيورو اميونولوجي برضو عندهم الام اس وهذه الاشياء، يحولوا لنا كثير حالات، سوي لهم رايزوتوميز، سوي لهم باكلوفين بامب انسرشن، يعني بايوبسيز وات ايفر. Did I answer all of your questions? Let me just screen whether there is anything missed.
الله يسعدك دكتورة. We just have a few questions for the upcoming residents إن شاء الله. So how many residents do you accept each year تقريبا? Especially
والله so far we've been accepting one per year. Yeah.
Okay.
صار لنا يعني since we opened أنا الدفعة اللي قبلي كان في بس one of the first resident في التخصصي دكتور آدم مرزوق، فهو كان الأول، وبعدين أنا، بعدين بعدي كمان أحد. فزي كده إنه كل سنة شخص واحد. في بعض السنوات يقفلوا، يكون ما في مثلا بادجت وات ايفر، ما في لاين، فيقفلوا سنة. بعدين السنة اللي بعدها غالبا يفتحوا، بس غالبا one per year. We're fighting to make it more. بس يعني our main aim ال quality of the candidates، لأنه it's quite يعني hard on us إنه أحد يجي ويتخرج و we can't help him with the fellowship or something. فعشان كده يعني we're trying our best إنه الكواليتي تكون أفضل أهم من الكوانتيتي. How can medical students collaborate with doctors? Email us directly or attend to our office during the working hours through the secretary, or take an appointment through the email. And I don't mind حتى people reach me out over the phone, بس يعني I apologize if I didn't answer because of our surgeries and hectic lifestyle as you predicted already. بس يعني في النهاية البنات أنا لي لهم نصيحة خاصة، إنه النيوروسيرجري مرة حلو، بس مرة demanding، ومن كتر ما هو heavy يعني تصيروا ما تقدروا يعني تسووا مثلا أشياء خفيفة مع مثلا الأولاد يقدروا يسووا their hobbies while they're working. يعني تلاقيه مثلا politician وهو نيوروسيرجن، تلاقيه مثلا بطل في الباسكت بول وهو نيوروسيرجن. البنات يعني being neurosurgery لحاله يمتص كده حياتك كلها. فأضيف إلى ذلك ولد ولا بنت وطفل يعني، أو طفل صغير وحمل ولادة، ف it's not an easy decision to take. بالذات انتوا تاخذوا هذه الديسيجنز وانتوا كم اعماركم؟ تخرجوا من الجامعة يمكن 24، فيعني you're so young to make this lifelong commitment. تنبني عليها كل التشويسز حقت your life later on. طبعا I don't guarantee you انه اذا ما دخلت النيوروسيرجري حتكون حياتكم احلى، بس النيوروسيرجري مرهق جدا، مرهق للاسف يعني. بس الحمد لله الحمد لله يعني أنا I think إنه يا رب لك الحمد، ربنا أكرمني ب very very smooth path، وأتمنى لكم إن شاء الله زيي وأحسن بإذن الله تعالى. بس يعني أستخير ربنا في كل خطوة عشان ما تندموا لا سمح الله. الله يوفقكم يا رب.
الله يعطيك ألف عافية دكتورة. Thank you so much for your time and for this wonderful talk. like to
الله
بأجرك.
يخليكم
الله
يا
يخليك.
رب جميعا إن
أجمعين.
شاء الله. وإذا احتجتوا أي شيء كلموني anytime. يلا
بإذن
بالتوفيق.
Have a
I
wonderful
can leave.
Yes, thank you so much. الله يعطيك العافية.
يلا باي باي، الله
مع
يسلمكم، مع
السلامة.
السلامة، باي باي.
مع السلامة. So guys, we will be taking a short break inshallah, and we are going to be back at 3:15 to continue our program. Inshallah. Assalamu alaikum everyone and welcome back. We're just waiting for the doctor. Inshallah, we're going to start as soon as he joins. Dr. Yasser is in the OR. Inshallah, he needs just a few minutes to join us. بإذن الله.
الو
السلام عليكم دكتور.
السلام عليكم.
الله يعطيك ألف
معلش تأخرت عليكم معلش.
ولا يهمك. الله يعطيك يا رب.
Yeah, this is a good example على neurosurgery. يعني a time is not yours. ها؟ طيب هو do I need to presentation ولا ممكن just كذا question answer ولا
اللي
what
يريحك.
you
اللي يريحك. Whatever works for you.
طيب. لو بحط البرزنتيشن كيف أقدر أسوي لها؟
في على الشاشة بutton مكتوب عليها شير، تضغط عليه وتكبس شير.
وين أحصل الشير عفوا معلش.
هو موجود تحت.
اوكي خلاص حصلت. شير سكرين شير. اوكي سو شير طيب واضحة الحين ولا؟
ايه واضحة دكتور.
طيب خليها فول سكرين. present. طيب السلام عليكم. Welcome everybody. I'm Dr. Aseer, neurosurgery consultant, program director of neurosurgery in the Western MOH. So briefly, let's start by talking about what is the vision or mission of the neurosurgery training program. The vision is to provide the community with well-trained graduates who will be potential leader in the field of neurosurgery. So we are looking for better program, for better outcome, for better patient care. The mission is to institute progressive neurosurgical training that comparable with the world program. So what is the neurosurgery? So what is the idea? What is your idea about neurosurgery? Maybe if you wanted discussion, I would prefer discussion. So what is the idea of the audience about neurosurgery? What they know about the neurosurgery? They can talk or not? Hello?
Yes, they can دكتور. They can. So please whoever.
Okay. Anyone want to volunteer about neurosurgery? What do you know about neurosurgery? No one? طيب. The neurosurgeon usually is treating wide variety of disease, and is that related to the nervous system, central nervous system, peripheral nervous system, spine, cranial, peripheral nerves. Okay, all of these is under the umbrella of neurosurgery. This is in contrast with the usual teaching, because most of the students or graduates from medical school, they mainly know that neurosurgery, epidural, subdural, head injury, ICH, this stuff. But actually the neurosurgery is bigger than this. So we are treating congenital or pediatric disease. There are a variety of congenital and pediatric disease. Degenerative disorder in the spine, trauma, tumor or neoplasm in the cranial or the spine. The spine could be in the vertebral body, epidural, or inside the cord. In the cranial, the tumor could be in the skull, could be in on the cortex or could be intraaxial tumor. Okay. Vascular disorder, there are a variety of vascular disease that also treated by neurosurgery, like vascular malformation, carcinoma, aneurysm, different disease. Also in the spine, same thing. Infection, like abscess, epidural abscess, subdural abscess, spondylodiscitis, and functional disorder. Functional, like we are treating pain, we are treating also epilepsy, Parkinson, or some movement disorder. So this is under the functional neurosurgery. So this is briefly about the neurosurgery. Then how you will apply? Usually the application for neurosurgery, like other program, it will start first. By applying in the Saudi Commission. Then after you rank to the neurosurgery according to your score, then you will match with the neurosurgery, and then we'll do second match with which is interview. So the first match is depend on the SMLE, which take the most bulk of the score, followed by the GPA, and 15% is your portfolio. Mean the volunteer, CV research, conferences, courses, extracurriculum things. So this is 15%. So then according to your mark, and each year the mark is different, so it's not fixed. So if you are matched with a neurosurgery, then we will do interviews, depend on the availability of the seat. Different year, we have different number of seats. Most of the time, in our center, we are taking 2 residents per year, one in King Fahd, one in King Abdullah Medical Complex. So 2 residents per year, usually. And the interview is, we are doing one interview together. We are meet together and do interview, then the resident will select the center. But in reality, because we are in Jeddah, the program is shared program, or is rotating. The resident will rotate. It's not single institute program, except the National Guard that started this year. They are a standalone program. The other hospital is shared. So it doesn't matter which center you are, because you will rotate in all the centers. So this is briefly, this is our King Abdullah Medical Complex Hospital. Adult pediatric still, we didn't start the pediatric neurosurgery. We have other pediatric hospitals. And the other hospital is King Fahd General Hospital. So those main hospital in Jeddah that under MOH umbrella. So this is briefly about the neurosurgery and how you will apply to neurosurgery. So the floor is open. If you have any question you want to inquire about anything, you are most welcome.
الله يعطيك العافية دكتور. What are the qualities that you look for بالاpplicants?
والله usually طبعا نحن we are concentrating more on the interest. Yeah, score is okay. It's good because you work hard to get a score, but a higher mark doesn't mean you are eligible for neurosurgery. Because neurosurgery is, I believe, is different than other neurosurgery. You need to love it. You need to like it, because you are dealing, most of our cases critical. The on-call, when they call you, you need to act quickly. It is stressful on-call. The work is stress. The reading, you need to read more. You need skills. So you have to have interest. You need to have interest. Okay? Because if you don't have interest, either you will not do well, or you will realize that this specialty is not yours, and you change the program. And it's happened. Some residents, they started with us, then after first year or second year, they change the program because they think, they feel that is not their specialty. So we are looking at, did you do any conferences? Did you attend any courses, research related to neurosurgery? Did you do any elective in neurosurgery? And the recommendation from the neurosurgery. Yeah, because this is the most, because this is that will tell me that you like neurosurgery. But if you have, for example, give me a recommendation from medicine or from pediatric, and you are applying for neurosurgery, so I will not put you on the top of the list because this means that you didn't work too much in the neurosurgery or do elective. If you didn't do conferences, you didn't any workshop, this also can have a point that impact on your selection.
طيب دكتور, what about the operative volume as a resident? كيف عدد الحالات اللي يشوفها الريزيدنت و get involved in تقريبا؟
resident ولا نتكلم انتوا على student when you apply؟
على الريزيدنتس. يعني later on become residents إن شاء الله, كيف الحالات بتكون during residency؟
طبعا during residency الحالات is variety. طبعا نحن في training ما ادري, maybe you hear it from the previous colleague. neurosurgery زي ما انتم عارفين هو في عندنا نحن في off surface rotation وفي neurosurgery rotation. off surface الريزيدنت يسوي في الجي اس, يسوي في الاي سي يو, يسوي في النيورولوجي, يسوي في نيورو راديولوجي. فهذه يعني تقريبا total 1 year off surface. فالبقية طبعا total 24 months general neurosurgery. يسوي oncology skull base, يسوي pediatric, يسوي spine, يسوي functional neurosurgery. So depend طبعا في جدة still we are not like Riyadh, for example. We don't have dedicated let's say section. For example, we don't have skull base unit. We don't have pediatric unit. Maybe now the National Guard just started, but in the most of the hospital, the resident will, when come to the hospital, he will rotate with all consultants. So yeah, I cannot send you, for example, to do pediatric neurosurgery. I cannot send you to do skull-based neurosurgery only, because still we don't have in the hospitals unit. We have the subspecialty. We have consultant with subspecialty, but it's still not a unit. So when you come to the hospital, either King Faisal specialist, university, in MOH, you will rotate with most of the consultant. The consultant, they have different subspecialty. So you will see a variety, depending on the hospital. Some hospital, they are doing more skull-based, some hospital more pediatric, some hospital more spine, some more trauma. So it's different. Each hospital, you will learn something from.
الله يعطيك العافية دكتور. في question من بعض من الأودينس. What about the GS recommendations؟ يعني حضرتك تكلمت عن البيدياتريكس والانترنال ميديسن, بس الجنرال سيرجري recommendations هل تاخذون بعين الاعتبار ولا it's just solely neurosurgery؟
طبعا هي كلها تاخذ بالاعتبار. We are taking consideration, but I mean when you have, for example, 10 applicants, okay, and one of the applicants, all of his recommendation is away from neurosurgery, okay, and another applicant, all of his recommendation from neurosurgery, and he did rotation in neurosurgery. He attended courses. See, when I try to select ranking, The other one maybe get higher score because he did more in neurosurgery, so he understand. Because to do, like I said before, to do neurosurgery, you need to understand the specialty. It is not that you see it in movies or series, or you hear about it. You need to practice. You need to feel it to see if you like it or not. Because neurosurgery, like I told you before, you need to like it. To be good in neurosurgery, you need to like it. So because it's stressful, lifestyle in the neurosurgery is not like the other specialty. This is to be clear for everyone. This is mainly in residency, but after residency still, but the stress is less, but still neurosurgeon, because we are dealing with life. Patient will comatose, decreased level of consciousness, he will herniate, or he will come paraplegia. You need to act. Always we need to act fast. We don't have, usually we don't have, most of the time, cold cases. So you need stress. The number of the resident is not big. So the number of the on-call is more. The load in the duty during the inpatient care clinics is more, because we are not the other specialty. For example, you will find in hospital 4 or 5 residents only, and you will distribute the work between yours. So this is what I mean. So if someone come to me and he did something in neurosurgery, this means he show interest in this specialty. But someone, he didn't do anything in neurosurgery and said, okay, I want neurosurgery. How do you decide that you like neurosurgery? You need to prove to me that you want neurosurgery, you like neurosurgery. You can continue in this life or this training program. Because I don't want to accept someone and then in the middle he realized that this is the stress, he cannot accommodate this lifestyle.
Thank you so much دكتور. طيب في سؤال ثاني عن السبونسرشيب and if there are any special considerations للسبونسرشيب.
والله نحن في MOH في العادة usually يكون سبونسر لما يفتحوا سيت في العادة تكون سبونسر by MOH usually.
اوكي ممتاز. ويسألون برضو عن does the relation with the residents extend after the residency program؟ إن هل بيكون عندهم job opportunities MOH جدة programs؟ يعني الأفضلية تكون لهم ولا لا؟
والله طبعا يختلف، لأنه طبعا نحن government طبعا usually الكونتراكت اللي يكون مع الريزيدنت في البداية يكون training contract، عقد متدرب. يعني بعد نهاية طبعا نحن 6 years after the end of the residency the contract will finish. Okay, then you need to apply for another job title. After the board, you will classify your certificate to be registrar or senior registrar, depend if you pass the board or not. Then you will apply as a different job title. So because initially you will get only what we call it training contract، عقد متدرب. بعض الريزيدنت يكون هو سيرفيس ريزيدنت. يعني what is mean service؟ يعني يكون هو مقدم على ال MOH كوظيفة طبيب مقيم، فهذا يكون يشتغل في المستشفى whatever specialty كطبيب مقيم، فيقدم إيفاد internal scholarship، إيفاد داخلي، ويدخل البروجرام. هذا يكون الجوب حقه secured، يعني بعد ما يخلص البورد his job will remain because he has a contract as a employee, not trainer. not training. ف different على حسب إذا أنت عندك initial job قبل ما تبدأ البروجرام، هنا حتقدم إيفاد داخلي ويجيك موافقة، وبعدين ويصير sponsored by MOH. بعد ما تخلص التريننج ترجع للمنطقة اللي سوت لك إيفاد، وبعدين على حسب أنت عديت البورد ولا عد، بعدين ترفع إعادة تصنيف لكن اللي ستيل فريش جراجويت ما عنده جوب لا، يكون عقد متدرب.
اوكي. في سؤال برضو عن الفيلوشيبس بعد الريزيدنسي، هل موجودة في MOH جدة؟ وهل في مقاعد لغير السعوديين؟
والله طبعا سكولرشيب طبعا هذا لها موضوع، يعني أنا ما باهم تفكروا don't think يعني now about it because اللي موجود في الMOH زي اللي موجود في الأذر هوسبيتال. السكولرشيب موجودة في كل محل بس تختلف كل سنة عن سنة، يعني ما هي فيكست، سواء في الكينج فيصل، سواء في اليونيفرسيتي، سواء في الناشونال جارد، سواء في الأموية. ف is not ما هي فيكست، فما أقدر أقول لك إنه في بعد إن شاء الله بعد 6 سنين في بوزيشن سكولرشيب ولا لا، بس ما يعني this is not a big deal، يعني don't concentrate on it. فما هو مهم بالنسبة لكم حاليا، لأنه هذه متغيرات تصير كل سنة تتغير.
إن شاء الله دكتور.
بالنسبة لغير السعوديين طبعا نحن آه، أهم شيء إنه أنت يعني يجيك قبول في الهيئة، يعني جاك قبول بعدين كوظيفة إذا أنت قدرت تجيب سبونسر ما عندنا مشكلة، لكن هي يعني ك كبوليسي إنه سعودي وغير سعودي بالنسبة لنا لا ما في إشكالية، بس إنه أهم شيء إنك أنت تجيب acceptance from the Saudi Commission، وبعدين نشوف موضوع السبونسرنج.
ممتاز. طيب بخصوص الريسيرش opportunities بالMOH programs، هل في research opportunities وهل it's mandatory for the residents to do research ولا لا؟
طبعا نحن زينا زي other hospital because we are under the umbrella of Saudi Commission. البروجرام زي ما قلت لكم هو طبعا under western program يغطي أكثر من hospital، ف of course طبعا هو required. في عندنا نحن في resident نسوي research عندنا، فهي على حسب الانترست حق الريزيدنت والتوبيك، he like the topic ولا لا. ففي سوينا ريسيرش في عندنا، وفي always في ريسيرش سواء في الكينج عبد الله أو في الكينج فهد.
طيب دكتور، كيف الكول سكجول؟ يعني كم اون كول بيطلع لكل ريزيدنت تقريبا في الشهر؟
زي بوليس حق الهيئة، بوليس الهيئة إنه ما يزيد عن 7 في العادة، يعني ريرلي يكون أكثر من 7 في العادة، يكون ماكسيموم 7، بعض الأحيان يكون 6 على حسب العدد، حسب العدد.
اوكي ممتاز. طيب دكتور، هل عندك أي نصيحة ممكن تنصحها لطلاب الطب اللي إن شاء الله بيقدموا على البروجرام حقكم، كيف يقووا الابليكيشن حقهم؟
والله طبعا زي ما قلت أهم شيء يعني work now hard from now. if you really like neurosurgery try to do elective. يعني واحد من الريزيدنت جاء ودفع فلوس وسوى، هو already graduated وجاء سوى زي attachment عشان يزيد من فرصه. طبعا في كورسز، طبعا حاليا في الشهر الجاي في Saudi Association Conference، في always every year they are doing boot camp. ف try to involve in neurosurgery. So this is for you and for also application for you. So maybe you will realize that this is not your specialty, and it happened. Some intern came to us, then when they started the elective, they realized that no, they didn't like, they want other specialty. Okay, try, you need to try, you need to test the specialty. You cannot decide this is my specialty without trying it. So that's very important. Get high score in the SMLE and work more on the portfolio, the things that related to neurosurgery to increase your chance.
بإذن الله. الله يعطيك العافية دكتور. Well, thank you so much for your time.
أهلا وسهلا، أهلا وسهلا، فرصة سعيدة.
أستاذ أهلا وسهلا.
السلام عليكم.
وعليكم السلام. Thank you all for joining. As the doctor mentioned, inshallah, the SANS annual meeting is going to be held in Jeddah, Dr. Salman Al Habib Hospital. The pre-conference workshops are going to be on the 3rd of April. The conference program, inshallah, is going to be on the 4th and the 5th. So make sure you join us, inshallah ta'ala. And the series continues. This did not end, inshallah. Make sure you follow our Twitter account, sans_students. I've wrote the account name in the chat box for the future programs, inshallah, around the kingdom. And thank you all for joining again. Have a wonderful rest of your day. السلام عليكم.
على حسب نشوف الكونفورت ليفل تبعهم يصيرون either attached يعني من انكولين الى 3 انكولات يكونون attached with somebody attached calls وبعد كده if they feel comfortable خلاص ياخذون انكولات لحالهم. من R1 إلى R4 they are first on call in-house on call. في عندنا طبعا غرف on calls خاصة للفيميل غرف on call خاصة للميل. وبالنسبة للR5 والR6 لا ندلعهم شوي يكونون second on call and home on call. احنا طبعا يعني نلتزم في نظام الهيئة. ما في عندي ريزيدنت جونيور ياخذ 8 أمانة ما في جونيور ريزيدنت ياخذ أكثر من 6 في العسكري يعني على مدى الروتيشنز كلها على اختلافها. السينيور نفس الطريقة لأن احنا عندنا في بوزيشن سينيور ريجسترار. فالسينيور السكند اون كول الريزيدنت يعني ياخذوا ما بين 5 إلى 6 اون كولات. نجي للروتين حق اليومي. عدد العمليات عندنا 7 عمليات بير ويك. الأحد يوم السبت في غرفة اللي هي تبع الفانكشنال ابيليبسي والأحد في غرفة والاثنين غرفتين وبقية الأسبوع في غرفة. في 2 rooms operative OR. الOR حتى Neurosurgery يمكن شوية special than the other hospitals إنه إحنا ORs حقتنا في اليونت. فخلاص كل شيء يعني you get familiar مع النيرسز مع you feel إنه كذا اليونت صغيرة و everybody is available all the time. دائما في غرفة قاعدين فيها الكونسلتنت الغرفة الثانية قاعدين فيها resident senior registrars اللي هي غرف الميتنج حقتنا ومنها تدخل خلاص هذه بعدين جوا غرف الأوبريتيف الريكفري بعدين الأوبريتيف روم. so you feel يعني مرة familiar مع الOR ما حتتغير عليك ما في غرف ثانية it's these 2 rooms. وفي intraoperative MRI كمان هذه OR ثانية راح تفتح هذه الشهر. بالنسبة للOR تقريبا العسكري يصير فيه حوالي 515 حالة 510 حالات بيريد. الإكسبوجر أنا أشوفه very fair يعني أنا لما كنت يعني every month كل 3 شهور طبعا نقعد مع الريزيدنت أخذ اللوج بوك حقهم أشوف كم الحالات أتناقش معاهم الرول حقهم إذا هم مبسوطين ولا لا. every rotation عبارة عن 3 شهور. 6 أسابيع يكون في mid evaluation feedback حتى يعني مو بس evaluation both way يعني feedback من الريزيدنت والفيدباك يكون من الكونسلتنت. بعد كذا في 3 شهور اللي نقعد ونراجع فيها OR exposure والرول حقها. يعني I'm so proud إنه actually في العسكري as يعني كان سنتر اللي everybody wanna come لما يكونون R5 مو إنه الجونيور ما يشتغلون لا الجونيور يشتغل بس الأماونت في الإكسبوجر للR5 والرول حقه داخل العمليات والرول حقه داخل العمليات I think it's one of the best hospital أمانة في تركيا. عشان كذا كان الجوينت البروجرام الفليسي والجامعة وهو الآن still R5 they requested this year to come unfortunately and I don't want to compromise كمان الإكسبوجر so I couldn't accommodate them لأن أنا already كان عندي 2 R5 R5 يكون هو السينيور في التيم يعني يكون الإكسبوجر حقه ما بين 3 إلى 4 أيام عمليات في الأسبوع. I don't want to take this away from R5 هم السينيور وأحس إنه إذا R4 و R5 يعني this is يعني golden years حقتهم إنه يشتغلوا more في الOR. بالنسبة عندنا في fixed academic schedule يوم الاثنين الصباح هذه سنة يكون نازل الجدول فيها، والresident they just established study group يقعدون في المستشفى 3 مرات في الأسبوع. I encourage them. أنا أشوف إنه either they have general discussion about the topic يفتحون من يوم، فهذا الشيء خلاص established الحين عندنا في العسكري إنه resident 3 أيام في الأسبوع they sit together and they study, they discuss the topic. وبعدين السينيور الشيف ريزيدنت يرسل لهم open book exam MCQs about the topic that they discuss تقريبا على الويكند، بحيث إنه يحلونه، ويوم السبت they review the cases together عن طريق الواتساب جروب حقهم. For the research opportunity ما في، أنا شفت إنه تسألون في dedicated time. لا، من الأساس إن نظام الهيئة عندنا إحنا في Neurosurgery ما في dedicated rotation for ما إحنا زي في programs فيها زي البيدياتريك الانترنال ميديسن عندهم dedicated rotation. وactually we do have accredited center حق العسكري حق الريسيرش سنتر عندنا هو accredited من الهيئة إنك أنت تمضي فيه الروتيشن، لكن نظاما من الهيئة أنا ما عندي. لكن إذا أحد حابب ياخذ الإلكتيف حقه ريسيرش في الريسيرش سنتر عندنا يس شور اللي هو الإلكتيف روتيشن. The good thing إنه إحنا الريسيرش سنتر موجودين و they're really active من ناحية إنهم they help you with the يعني connect you to statistic people. They audit هذا proof reading المانسكريبت حقه قبل. حتى طلبت لهم آخر مرة كان في النقاش بيننا إنه نبغى أحد for diagrams وكذا إنه يصمم أو يعدل يسوي لنا auditing على الصور إذا أحد احتاج. So they were welcoming. في coordinator من الريسيرش سنتر each department يعني resident عندهم أرقامهم و they feel free to يعني to ask and they will help them. plus إنه أساساً في research day ويكون في جوائز على أفضل researches اللي تقدمت among يعني الليفل حق الريزيدنت. بالنسبة كمان على اللاب ما في dedicated lab صراحة في العسكري، لكن العسكري نفسنا إحنا as a neurosurgery department we conduct three courses per year. في عندنا course اللي هو just relate هذا general course it's about understanding the basic anatomy الدريل set الشغلات اللي زي كذا. وفي كورس ثاني اللي هو كان هذه السنة سوى كمان كان vascular course عبارة عن anastomosis و working على side to side anastomosis or end to end anastomosis. وكمان another workshop conducted طبعا الرزق حقينا كلهم يحضرونها اللي هي cranial synostosis workshop كانت تسوت هذه السنة في البيدياتريك. السنة اللي فاتت we were able to have 2 heads fresh cadaver heads يعني كان in collaboration مع ENT وأخذناهم وسوينا عليهم يعني اللاب موجود السنتر كهذا it's well يعني well established و well equipped كمان بس كانت بعض الأحيان المشكلة إنه في الهيد نفسها واللاب they don't preserve it for us. كان عندنا مشكلة في الستورج إنه وين نخليها، لكن كنا we borrowed 2 heads من other course تبع ENT. We did all the surgical approaches في اللاب على مدة 2 يوم. كان تطوعي للريزيدنت اللي حابين يجوا. إيش كمان كان في part تبون تسألون عنه من ناحية يعني to sum it up and I think إنه as a program we have all the neurosurgical subspecialties. I'm proud to say إنه 50% of our consultants أساساً اللي موجودين local graduate من العسكري هم كانوا resident في العسكري including myself. وطلعنا fellowship كلنا برا اللي أخذ في كندا واللي أخذ في كوريا واللي أخذ في بريطانيا ورجعنا مرة ثانية as a consultant our institution. The opportunity to be sponsored by the opportunities to be sponsored by العسكري بس ما هو as a resident يعني بعد ما خلص residency program if there isn't a job for a senior registrar or a post for a fellow yet العسكري do sponsor ويرسل لك بس إنها هذه ما هي guaranteed يعني ممكن الجراديويت عندنا رجعنا أخذناهم لكن أغلب الجراديويت تبعين كان في لسه نيت at least خلال 3 سنوات اللي فاتت we sponsored them we offered them a job as a senior registrar we sponsored them for fellowship. فهذه من ناحية اللي هي الفellowship opportunity اللي هي البرنامج بس البرنامج مخرجات البرنامج بشكل عام باعث لما نجي نتكلم عن الريزيدنسي بشكل عام as a neurosurgery يعني things that يعني قد إنه الانترنز بس يكون في بالهم they have to ياخذوا rotations ياخذوا rotations في البروجرام في السنترز اللي هم حابين really to be sponsored by لأنه إذا أنت ما جربت الانفايرمنت حتى مثلا أوكي أنت مثلا يكون كويس at OR exposure أنت سمعت ممتازة في الأشياء لكن تجي مثلا تصدم في it's not your expectation في environment كتيتشنج كعلاقة مع consultant كcolleagues wise مع other resident فأنا أشوف دائما إنه الأفضل وهذا even increases your chances إن أنت أو أنت get accepted as يعني they consider you فعلا sponsoring you training center إذا أنت you show up during your internship وقت عندهم rotation ومنها to judge the place حتى بشكل عام النيوروسيرجري بروجرام يعني ما أبغى يعني أكون يعني ما أكون سلبية عليكم أو شيء بس it's one of the toughest programs أمانة as a training أول شيء بسبب طول السنوات 6 سنوات غير عن كذا كل البرامج بغض النظر يعني إيش كان العدد ما تلقى العدد الكبير as a resident يعني العسكري now total number of residents اللي موجودين عندنا now في التريننج 9 أكيد بيكون في منهم أوف سيرفيس يعني يدرس جي اس أو سي يو بكون يجيبوا تقدر يدرس أوف سيرفيس روتيشن لكن during each rotation في 6 residents فقط فثلاثة in each team هذا العدد من العمليات وهذا العدد من الكلينيك والinpatient it's not an easy program it's a hectic program in general في أي مستشفى بس الأشياء اللي تساعد إن أنت يعني go through هذا البروجرام يكون اللي فيها تركيز التعليم فيها challenges بس يعني challenges اللي مع motivation يعني أنت تحس فيه reward إن أنت فعلا تحس نفسك متأقلم مع المكان عشان واحد يعني قد ما يقدر يكون سميث سموث training بس neurosurgery in general it comes out tough يعني على قولتهم لما وصلنا ما أقول أوكي أنا ما بقول لك بس أنت تكون بحق الألغام بس بنفس الوقت ما تفكر يعني السفر يعني أنا بالنسبة لي أحسها كأنك داخل بالنسبة للأسف بالنسبة تحتاج a lot of dedication تحتاج a lot of يعني unfortunately compromisation يعني ممكن نفس الطريقة الواحد يحاول حلو الكلام إنه يوصل اللايف بالانس وإنه نحقق الأشياء بس unfortunately في فرص لما تجيك في residency program تجيك على مرتين وبعدها ممكن إنك أنت يعني بعد ما تخلص التريننج تحس إنه it's worth it إنه أنا I spent all of this amount of time و effort حطيته علشان لما أخلص وأوصل للبورد اللي أنا فعلا I feel like I'm happy وواثق من نفسي وأحس إني yes I can practice as general neurosurgery anyway هذا الهدف in general هذا الجول هذه الرؤية عندنا في الديبارتمنت إنه أنا لما أجي أطالع من الريزيدنت حقي ما يهمني he's excellent superb مثلا في الإكليبسي for now as an R5 ولا R6 ولا he's featured في البدايات في الفايت أنا I don't look at بس أنا لما أجي أطالع من المخرجات عندنا في البرنامج يهمني لما أجي أطالع هذا الشخص I feel yes he can practice anywhere as a independent neurosurgery general neurosurgeon can do most يعني كل الفيسز اللي تعتبر within the capability of anyone who's specially graduate as a general neurosurgeon هذا الأيم حقي قبل أي شيء ثاني من بعدين عاد إنه أوكي you have specific interest معين at the end of your residency إنه حطيت في بالك fellowship معينة حطيت في بالك fellowship معينة we can يعني accommodate بس الهدف الأساسي لما أجي أطالع كمخرج إنه هذا الشخص اللي بقول له yes you can go ahead and sit for the board exams إنه he's safe they're safe they know their limitations and they can practice and do the things that any neurosurgeon في أي مكان في العالم can do ما هي specialized case. بالنسبة للمعايير عندنا في الهيئة للبرنامج المخ والأعصاب يعني بعدين أنا بكتب إن شاء الله في البرنامج كذا في معايير تطلعون عليها في البداية اللي هي معايير الترقية من سنة إلى سنة في عندنا أغلب أقوى معيار هو الإيفالويشن فعشان كذا لما تدخلون البرنامج أو ممكن تكتبوا feedback seriously لما يجي يسألكم يقعدون معك من الكونسلتنت and they'll give you feedback you should also give them feedback يعني لازم تكون honest about this لأن هي مو مسألة إنه تمدح والله everything is okay بعدين تنصدم لما نيجي عند الايفالويشن كذا إنه والله لا الفيدباك ما كان كويس. فsometimes which is أنصح مرة فيها إنه you can have feedback حتى لو verbal، حتى لو أنت ماشي في الكوريدور ولا في العمليات every 2 weeks just to see خصوصا في البدايات إنه أنت وينك بالضبط، عشان مثلا ما تجي تنتبه إنه والله ده عندك روتيشن ولا الايفالويشن ما كان أفضل شيء. إنه أكيد إنه أنت قاعد معاك وأعطيته فرصة وفرصتين to give a true feedback about the rotation. ودائما خلوها كذا إنه just general idea خلاص إنه الفيدباك مو only to evaluate قضية rotation and to evaluate المكان اللي أنت يعني your experience في المكان توقعاتك إيه بالنسبة لك. ودائما أنصح الريزيدنت قبل ما يبدأ كل سنة اللي في جول لهذه السنة، فلما تيجي تناقش الروتيشن والريكوست حقتك مع البروجرام دايركتور يكون في هدف في راسك. فحتى لما تطلب روتيشن معينة في أماكن معينة لما يكون في جول تتناقشون فيها things will be easy for both of you إنه to accomplish أو يعني at least نوصل يعني طرق الحل وسط بين التوقعات والأشياء المطلوبة. هذه النقاط اللي كنت حابة أتكلم عنها. حفتح المجال للأسئلة إذا في أحد حابب يسأل أي شيء.
يس دكتورة، في عندنا سؤال يقولوا is there a chance for someone who has not taken a rotation in the military hospital؟
طبعا لأنه في النهاية مو كل الناس I understand إنه as an intern ما تقدر يعني ممكن في بعض اليونيفرسيتيز ما تعطيك أكثر من 2 روتيشن في التخصص اللي أنت تبغاه عشان تخلص الأدر ريكوايرد يعني البيدز والإنترنال ميديسن والأوبس تنقاني إنه لازم تتخلص. فممكن ما يعطونكم أدن إلكتيف ولا الجي هذا إلا شهرين. I understand إنه مو دايم يعني في 5 الله كذا مستشفى في الرياض. لا في ناس قبلناهم وهم ما أخذوا عندنا. بس طبعا دائما الأولوية إنك لما أحد يكون يشتغل معك. بس إذا هذا يس لا فطور ما حيكون نو بيج نو يعني نو أبسولوت لا.
طيب دكتورة، أنت تكلمتي إنه السنة هذه صار في شوية separation عن الأذر programs في الجوينت بروجرام اللي كان موجود. مستقبلا يعني هل residents العسكري بيكون عندهم فرصة إنه ياخذوا outside rotations؟
يا شور. أنا mainly هي كانت تعميم من المستشفى بس بعدين قدرنا شوية يعني نقنعهم إنه لا Neurosurgery program still I think إنه for the benefit of the trainee مو لأي أحد ثاني إنه يطلع يشوف other things خصوصا في مستشفيات مثلا subspecialized بحاجة معينة بس أنا ما أفضلها في الجونيور يير لأنه أنا اعتقاد تام إنه التريننج عندنا in general excellent. واعتقد انه احنا we're very motivated كذا ومتحمسين our resident. فيهمني انه يكون عندي في الجونيور يير واستابلش الكونفيدنت عنده ويكون تحت عيني واهتم في البروجرس حقه واشوف اذا كان فعلا لانه اذا الريزيدنت خصوصا في الجونيور يير يروح روتيشن ويرجع لي مثلا مره واحده في السنه اشوفه وبعدين يروح I wouldn't be able to see his progress. واذا كان في عنده defect sometimes لما انت تروح وما تكون يعني الريزيدنت تبع السنترز unfortunately sometimes it do happen ما ينتبهون انه انت الديفكتس البسيطه اللي عندك اللي تحتاج يمكن لو انك قعدت مع البروجرام تبعك وعند والبروجرام دايركتور والدوير يكون البروجرس حقك افضل واحسن. فانا افضل في الجونيور يير امانه الى نص R3 انه الريزيدنت اساسا ما يطلعون اي روتيشن برا الميليتري هوسبيتال. بعد الR3 لا ام وذ ذات خصوصا اذا يعني خلاص بدينا مثلا احنا عندنا تروما بس ما هي فريش تروماز. مثلا في الفريش تروما I would love to send them مثلا مدينة السعود مدينة السعودية والشميسي مثلا أحد very interested في الفانكشنال الإبيليبسي ممكن أرسل التخصصي عشان الحالة يعني الاماونت اوف cases تكون يعني أكثر من اللي عندنا لأن عندنا in just part time. ولا مثلا أحد بيدياتريك وأخذ بيدياتريك already عندي ومبسوطة من الليفل حقه بيبغى يشوف حالات معينة ممكن أرسله للحرس. فلا المجال مفتوح بس مو في الجونيور ييرز.
دكتورة في أيضا سؤال بخصوص السي في والانترفيوز what are things that يعني you look at in applicants؟
شوف once الابليكنت وصل ما أركز مرة على مثلا المعدل والشغلات اللي زي كذا لكن يهمني يعني لما أشوف والله مثلا يجيني واحد during all في الميديكال سكول في الصيف وكذا ماخذ نيوروسيرجري الشغلات اللي أركز عليها مسوي ريسيرش مشتغل مع أحد كمان في النيوروسيرجري ما يهمني مرة how complex the research as إنه فعلا involved في الريسيرش. يعني أنا كنت مثلا أقرأ الريسيرشز حقتهم يعطونا إياها أقول لهم submitted. كنت يعني أقعد على السي فيز يعني مثلا أسبوع إلى 10 أيام أهد من لما ترسل لنا الأسماء وأخذها وأقرأها. فأي يعني أسألهم ideas عامة، من يعني ديب وإنه أنا لا أسئلة عامة بس تبي يعني أنت حاط اسمك و you were there. أحب إنه يكون في مصداقية يعني لما أنا أسأل وكذا على الريسيرش إنه فعلا يكون هو كاتب الريسيرش وانفولد فيه، مو مجرد داتا كولكتر كان أو حاجة زي كذا. فهذه واحدة من الأشياء اللي يعني نسأل فيها. وأمانة في أسئلة اللي هي على أشياء كذا في الكلينيكال سيناريو إيثيكال وايز وبروفيشناليزم وكذا نركز عليها أكثر من أي حاجة ثانية.
We have a question from a medical student that's attending.
Sure.
يسأل عن التريننج في السمر متى يفتح؟
يبغى share my email with whoever asked this question علشان هو يفتح في شهر المفروض يعني نبدأ 7 و8 احنا عندنا training، لكن ممكن نقبلهم after. بس ممكن I connect them with the academic affairs عندنا لأنه لهم في قسم خاص بس للستودنت ما لهم شغل في الانترن.
طيب دكتورة في سؤال يسأل كم ريزيدنت، واعتقد اجبتي عن هذا السؤال. 2 residents 1 sponsored وواحد لا. طيب I think this concludes the session. إذا أحد عنده سؤال في سؤال ثاني. اللي هو places that you collaborate with subspecialties outside. أعتقد أيضا جاوبنا على هذا.
إحنا بالنسبة مع التخصص يعني في السعودية you're welcome to join any center with rotation في أي center as long as the center is accredited من الهيئة. بالنسبة outside برا السعودية يعتمد هل أنت بتروح as hand on. إذا hands on عادي I can accommodate that وأقبلها as rotation. لو يجيني evaluation من البروجرام هناك من البروجرام دايركتور إنه أنت فعلا دخلت وعمليات. إذا كانت لا which is very difficult أساساً to have it as during the program يعني في لها process for licensing كذا تكون تطلع as an elective. هذه from your elective observership.
Thank you so much, Dr. Musha'al, for your time, and I think we got a good glance about the training in Prince Sultan Medical City. Thank you again for the talk.
العفو، الله يوفقكم يا رب، وإن شاء الله نشوف إذا المقبول منكم قريبة لأنه الانترفيوز. يلا بالتوفيق يا رب، يعطيكم العافية.
Okay, we may proceed to our second talk. We have the National Guard Health Affairs Residency Program, represented by Dr. Ala Arab. Dr. Ala, we extend our gratitude for participating in today's session. The floor is yours.
السلام عليكم.
وعليكم السلام.
طبعا السيشن, thank you so much for inviting me. وإن شاء الله we will clear up any questions anyone has during this time. I'll share the screen. Just a second. Do I have the authority to share a screen?
Yes, you are a co-host. You may share the screen.
allowing me to share the screen. Presentation, and there is nothing much with the presentation.
يقطع عندك شوية صوت دكتورة. لا حاليا لا دكتورة. قبل شوي كنا نسمع.
اسمعني؟
Yes, we can see you and hear you دكتورة.
تمام. طيب like راح يصير أنا هتكلم all the time. أتكلم point whoever has a question على any point you can interrupt me. تمام؟
واضح.
طبعا we'll start أول شيء بالprogram identity والmission. في النهاية
معليش دكتورة قطع الصوت بس. دكتورة معليش. We cannot hear.
الآن تسمعني؟
واضح جدا.
خلاص ممتاز. Okay, so if عندنا some subspecialties that are not covered by National Guard, we support our residents في areas of interest and they can take it wherever they want. However, لازم يكون في عندنا good hands-on. Otherwise هتصير observership and they will have to compensate for it. هذه بالنسبة للprogram entity. The training structure طبعا عندنا الروتيشنز اللي هي البيسك منها الاي سي يو الراديولوجي نيوروراديولوجي and neurology and GS هذه كلها off rotations. Residents usually take them 3 months per rotation and they're taken as a junior years يعني R1 R2 you take them. بالنسبة للراديولوجي, we really encourage our residents to take also interventional neuroradiology, which is available at our center. They're more familiar with the vascular procedures and the anatomy of vascular neurosurgery. هذه كلها provided. بعد كده حيصير strictly neurosurgery. Rotation تصير 3 months with each instructor أو mentor, and then they rotate.
ترى معليش بس انت you're presenting slides لانه ما نشوفها.
المشكلة sharing slides ما هو موجود. بس يعني there is nothing much. It's only
خلاص fine, yeah, it's fine.
If anyone has any question at any point, please let me know. عشان we will answer it at the same time. تمام. بالنسبة للأونكول سيستم إحنا عندنا 2 hospitals اللي هم المين hospital والكاش which is the pediatric hospital. Residents will be covering both, but not in the same call. So you're either on call bil pediatric hospital or the main hospital. And the minimum calls عندنا تقريبا 6 to 7 calls depending على residents اللي موجودين بالrotation. But sometimes it may reach to 9 calls. And في النهاية you're covering 2 hospitals. Progression of responsibility, it comes من junior إلى senior. It's not it's not because you're مثلا an R4 or an R5 you're already خلاص by default. لا. It depends on how you prove your skills. So if you're at the level حتى وأنت مثلا R3 you're given the responsibility ممكن of R4 أو R5. The hands-on with skills depends on your progress. It's not only about the number. غير كده على حسب الهيراركي اللي موجود بالOR. فlet's say إنه معنا senior junior. إحنا بالعادة في senior junior. فsenior always has a priority to do the allocation with delegation of the responsibilities between the residents. فإذا عندنا R5, R4, they're the ones who are نقول allocating the opening and closure للجونيور. How much the senior is confident. باقي ال parts of the surgery ممكن إنها تتوزع على الجونيور. فهذه فيها a lot of نقول variables. لكن by default depending on how much you have skills أو how's your progression إحنا نعطيك responsibility. تمام. بعد كده في عندنا clinical surgical exposure that you're talking about. فإحنا عندنا multiple specialties. عندنا spine which is very strong. في عندنا trauma. عندنا skull base. عندنا pediatric also is very strong. So vascular إن شاء الله soon they will be coming. فمن ناحية surgical exposure per year تقريبا Neurosurgery department more than 1,200 surgeries. Each day we have an open OR. On Wednesday we have 2 ORs running at the same time. Per day ممكن at least 3 surgeries per day. Clinical exposure. So if you're covering 1 consultant, depends on the team. Some teams you're covering 2 consultants. فيصير you have 2 clinics per week. أو إذا 1 consultant you're covering 1 clinic. بالنسبة للsurgical exposure زي ما قلنا يعتمد على your team how active. السبسبيشاليتي تكلمنا عنه والoperative autonomy زي ما قلنا depends on your skills, how confident you are, how much you know about the patient, about the anatomy, about the approach. So إحنا بندخل ال OR أو surgery you discuss the case. You have objectives. مثلا في هذا السيرجري this is what I want to accomplish. I want to accomplish مثلا dural opening للجونيور. If you're confident عندك good opening, you did the craniotomy right, you secured the hemostasis, you are following كل ال steps correct, then you have the privilege إنك to get to the dura. تمام? It's not خلينا نقول because you are in R1 ولا R2 ما حتفتح dura. لا. If you're good, have good skills, ممكن توصل للجورا. بدنا ندخل على التيومر depending على level. How much your skills you will get بالOR. Autonomy طبعا it's not complete autonomy. في النهاية you're under supervision. whatever the case is. بس ال EVDs الأشياء البيسك هذه definitely it has to be the junior. خلاص يعني هذه every junior should master it. منها ال EVD، منها ال burr holes for subdural hematomas، ال epidurals، ال craniotomies، decompressive craniotomies أو craniectomies. هذه كلها should be by default for the junior and you should master it. يعني ما يخلص R3 غير هذه الأشياء كلها in your pocket. تمام. الريسيرش طبعا الريسيرش احنا we're working on it، فيصير عندنا two research. فواحد هو long term عندنا short term. Short term اللي هو يخلص within 1 year. Long term can be prospective study that can end within like 2-3 years أو حتى by graduation. We really encourage the participation of in, whether it's an abstract, oral أو إنه journals. And you have the full support for the department. We have the K-Mark, which is a research center. You have support there, which gives you their approvals and support your research. Regarding the mentorship, طبعا احنا زي ما قلنا حتصير every 3 months you're with a mentor or a consultant that you are with. At that time, he's your mentor. Whatever guidance, whatever feedback, surgical approaches, you discuss it مع the consultant. At the same time, في عندك the deputy or program director, they're always there to support you. If you have anything to discuss. بالنسبة ل protected time for teaching, طبعا teaching doesn't only happen once a week. And then every other day we have a morning meeting. So this is protected time for a resident. ما يسوي فيه any other responsibility. من 8 ل 9 you attend the morning rounds, discuss the cases and present short presentations. غير كذا في عندنا every week we have a teaching. It's one presentation per week. With block system. Every 3 months تقريبا we have a block, whether it's general neurosurgery, spine, vascular, depending. But by the end of the block, we can do some kind of assessment, whether it's written. أحيانا ممكن نعطي articles and question articles that we discuss. Every week we have a spine round and journal club at the same time, which is every Monday. And every Monday there is also neurosciences that's combined with radiology and neurology. And once per month we have a tumor board. If you have a case or something, you will go and discuss the case with the pathologist and you will see the slides. You will discuss it with the radiologist and you will see the findings of the imaging. بالنسبة للexpectations طبعا احنا من ناحيتنا من expectations we expect you to be at your level أو above. احنا we always hope we target above the level. بس minimum انك تصير at your level and we make sure to give you a feedback every 3 months على your progression. طبعا احنا عندنا progression هذا يصير أو الفيدباك يصير من البروجرام دايركتور deputy program director every 3 months. With your mentor you can have it twice. اللي هو 6 weeks. You get 3 feedbacks per rotation. تمام. We always have an objective. دايما we recommend the residents to have their objectives and they have to meet it by the end of the rotation. بعد كده ال educational activities تكلمنا عنها والفيدباك سيستم الريزيدنت assessment تكلمنا عنه. في مو بس ال written evaluation, also have the evaluation throughout خلينا نقول ال year for the promotion. By the end of the year في promotion. We don't only rely على ال mentor, we have زي ما قلنا program director, other consultants, ال on calls. يعني you're being evaluated at each and every level. Whether it's discussions in morning meetings or spine round. You are evaluated at each and every level. طيب. بالنسبة للapplication and selection, eligibility, everybody is eligible to apply. أهم شيء إنك you completed your medical school and the internship. بالنسبة للسelection process it's a خلينا نقول a group of consultants. احنا we choose the residents based on or potential residents based on their qualifications. ايش هي qualifications المهمة اللي يقدموها؟ you should show your interest في neurosurgery. And you have at least خلينا نقول 2 or 3 rotations في neurosurgery, whether you're a medical student, whether you're intern, whether خلينا نقول elective that you took at any time, just to show how much you're interested in neurosurgery. You take calls, you do presentations, research. هذه كلها أشياء تبين your character إنك how much you are interested in neurosurgery and how hardworking you are. تمام. وفي غير كده الانترفيو يعني it shows us how do you deal with the questions, how do you answer, how do you present yourself. هذه مهمة. غير كده traits of a successful applicant. أهم شيء يكون applicant hardworking, shows interest في الفيلد, and you're aware how much time you are going to invest in neurosurgery. And it's not just خلينا نقول like any other specialty. You spend a lot of time. It will take a lot of effort, and it will take a lot of خلينا نقول part of your social life, and you're willing to give that up. وكيف حنشوف هذه لما نشوف الانترنز اللي مقدمين كيف لما يجونا during an internship أو خلينا نقول observership, whatever it is, they present themselves. يعني this is our chance to see you as a potential resident. Wellness and support system. So regarding the support system, you always have the support of the department, especially the program director. We have also chief resident. It's their responsibility to be in direct communication with residents. So if you have any issues, whether it's health issues, social issues, we can accommodate this. And will support your residency to continue and graduation بإذن الله. بعد كده إن شاء الله fellowship, as long as you know where you're going في وعلى حسب the spots that are available for the fellowship, you'll be fully supported. فهذه كلها تعتمد على your year. قد إيش عدد الريزيدنتس اللي موجودين, graduates والacceptance. لكن غير كده إذا أنت تبع الحرس تمام. Do we have any other questions?
يس دكتورة, في سؤال اللي هو على موضوع السيتس. يمكن أنت قلتيه في البداية والصوت ما هو موجود. كم بيكون في سيت إن شاء الله سنويا؟ كم سبونسر؟
For the past 2 years كانوا 3 fully sponsored من الحرس. مع الأغلب this year ممكن the same. احتمال يكون 4 seats احتمال. بس على الأغلب إنه ممكن 3.
طيب, if anyone has a question, please you can feel free to use your mic or ask it in the comment section.
أهم شيء إحنا if you're interested بالحرس, that you present yourself, you come at least 2 weeks, contact the program director, حتى head of the department interested, everyone is interested to get to know you. لازم تعرف بنفسك. إذا جيت واشتغلت for 2 weeks ولا 1 month أنت ما عرفت بنفسك, ما أخذت calls, ما سويت presentation, no one knows you, no one will recognize you بالinterview. You have to present yourself. وخلي الchief resident يشوفك, الprogram director يشوفك. Ask questions. You're always welcome to ask questions. Do research. Whatever it is, just make yourself known. عشان people can remember you during the interview بعد كده. والinterview حيصير فيها أكثر من شخص. الconsultants حيكونوا موجودين. The more people know you, And the more people know how hardworking you are, كيف أنت أصلا you're showing interest في الفيلد, that you're here to last. It's not just مثلا خلينا نقول سنة سنتين وبعد كده حتغير رأيك. This is what we care about.
We have one question from a student. They're asking about the OR. Are they allowed to enter the OR if they take any electives?
أي
Because they mentioned that last year it was not allowed.
لا they're
Has this
allowed.
changed?
في عندنا السكرتير عادل عودة موجود برج الجراحة. You can go there, get his email, I will contact. You can contact the chief resident. You can contact me directly. ما عندنا مشكلة. And everyone is welcome to do elective. All medical students.
That's great. Thank you so much. Thank you so much, Dr. Ala.
إن شاء الله. حياكم
Thank you
الله.
for giving us an overview about the program, and thank you for your time.
Thank you.
This concludes the session for today. We'll meet you next time, inshallah. We have a fourth installment for this open house series, inshallah. We will follow us on our socials and you will be updated, inshallah. Thank you all for attending and see you next time.
500 cases per year. And that includes, and that's not including emergencies. So 460, about 460 to 500 elective cases, maybe, plus trauma, plus emergency cases. And that's pretty much the summary of what we do at KSU's program. We have mid-rotation evaluations, end of rotation evaluations as always. And that's it. In terms of research, of course, I need to mention research. It is an academic center. We have a very active research group. Our neurosurgeons are all actively involved in research. Having the center being an academic one, having all the infrastructure really needed to run robust studies makes it kind of a great place to be if you're interested in academia and in publishing, because we do publish quite a bit actually. And there is also innovation happening where some of our colleagues in the Department of Neurosurgery are actively involved in device development, clinical trials. We do that, and like pretty much invention of new medical devices and taking them from concept to hopefully marketing. And Muhammad, am I missing anything? I don't know. I think I
Yeah, I think you covered most of the points. Just regarding mentorship, is there a structured mentorship program for residents?
Mentorship happens organically. I mean, we're not, there's 8 of us, and there's about 7 to 8 residents currently in the program. So you get a lot of one-to-one interaction with your trainers. And we do have a program to pair people, at least officially, if they ask to be mentored specifically by someone. But yeah, that exists. We help, guide you to what you're going to do next after you're done. When you're starting out, we try to kind of steer you towards what is expected of you, what you need to do to further be the best resident you can be. And whenever someone has specific issues that they want to be addressed, or when we find that someone has something that needs to be specifically addressed, we do that without hesitation.
We also have a question what do you look for in applicants?
I mean, just like any other program, we usually like to see people. We like them to rotate with us. It's always easier to accept applicants into the program when you're already familiar with them, as opposed to accepting someone that you do not know. Um, we definitely look at things like the CV, the exams, all the stuff that, the regular stuff, publications. But to me, at least, and I know to most people, other than myself, we do want to know you on a personal level. So my recommendation in that regard would be come visit us, do some rotations with us, and you're more than welcome. We're very easy to approach, very easy to work with, I think, or so I'm told. And yeah, always welcome to visit us for a couple of weeks, a month or so.
There's a question on are foreigners allowed?
Do you mean in the program as residents?
If Nafha, please clarify the point. Yes, I believe that's the question, Doctor.
So our program is part of the Saudi Council's like system, right? So it always depends on what their qualifications are or what their requirements are. The thing is, we do not usually decide on these policies. It's always back to the Saudi Council. It has to be through the match. So there is a matching process that you have to apply to. And once you match through that process, then we interview you and are able to decide whether we accept you or not. So I would say for that specifically, you'll need to look at the matching system requirements and then go from there.
Any specific points in the CV that strengthens your application?
I mean, we like a well-rounded CV, so it's good to have some volunteering work. It's good to have some rotations. It's good to have a couple of publications. But we like, there's no one thing that makes a CV better than the other. It's usually having a little bit of everything. And more importantly is knowing you on a personal level. To me, it's just easier to make a decision when I'm faced with someone that I already know on a personal level, that I know the work ethic of, that I know the personality and the willingness to learn and all that, than just someone who is, to me, like some information on a piece of paper. Not to say CV is not important, not to say that you only get accepted if you rotate. No, it's a mix of both. But I would say that there's no one secret to making your CV better. It's always if you have a good mix of everything that goes on it.
Okay. Are there any protected teaching times or academic days?
So Thursday is our academic day. We do have grand rounds in the morning and teaching self-directed resident teaching following that, followed by tumor board, which is on the same day. So yeah, there is essentially an 8:30 to 1 p.m. Every Thursday where residents get to learn and interact with the tumor board at the same time, like afterwards.
How are the on-calls in the King Saud University Medical Center?
Depends. I mean, they're not as heavy as other places, I can tell you that. But you have to remember it's a neurosurgery service. It's a neurosurgery residency. So it will be heavy at some point. It will be it's not going to be easy sailing. But I can tell you that it's not as heavy or hectic as some other places nearby.
Someone is asking about the minimum acceptance grade for your candidate last year.
it it doesn't really it's not about the grade, you know. Someone may have an excellent grade but did not perform well when they came to us in their internship, for example. Or someone may have a not ideal grade, but is someone who showed us that they are great and an excellent candidate. So um, I wouldn't focus too much on grades. They are important, like we do look at them for sure, but they are one element of a much bigger picture that we consider.
Someone is asking about if the research he's involved in the CV is out of neurosurgery. Does it make a difference?
It doesn't. I mean, we do understand that a lot of people come to the decision a bit late in life. I know that a lot of people can decide on pursuing neurosurgery only after they rotate in it as senior medical students or as interns, which means they may not have had time to publish in neurosurgery. I just view it like if someone has a published study in neurosurgery, that's the best it could be. If not, if they have published in something else, that gives me an idea that they are interested in publishing, they've had experience in publishing. And then finally, if someone tells me they are involved in some sort of research. So it goes, the hierarchy of that goes neurosurgery publication followed by any publication followed by being involved in something that may or may not get published.
Thank you, Doctor. I think you've covered all the points. Thank you for being with us today and taking from your time. Thank you so much.
Appreciate it.
5 minutes إن شاء الله.
وعليكم السلام جميعا وأهلا بكم جميعا يا أولادنا العزاز.
This meeting is being recorded.
السلام عليكم.
وعليكم السلام يا دكتورة ندى.
وعليكم السلام دكتورة أهلين.
سلام
دكتورة
مهند، كيف
بس
حالك؟ كويس؟ سلام
الحمد
بروف،
لله.
السلام عليكم.
وعليكم السلام.
نبدأ
إن شاء
الحين
الله.
ولا كيف تبغون
أيوه
نبدأ؟
بس 3 minutes على أساس إنه بس the number goes up وإن شاء الله we'll start.
Okay, good.
دكتورة ندى, I will start by introducing you firstly, and after that you will present our program, and after that we will wait for everything will goes as scheduled إن شاء الله.
إن شاء الله بإذن الله.
طيب. Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. Thank you all for attending today's open house session, your introduction to residency programs in Saudi Arabia. My name is Muhammad Mallat, and I am part of the organizing team alongside my colleagues, Payam Seidu and Raghad Al-Mutairi. I would like to thank them both for the tremendous efforts in bringing this project together today. This is the 5th installment of our series, and we are pleased to feature King Fahd Medical City in today's session. I am pleased to present King Fahd Medical City Residency Program Director, Prof. Orz Yamani, and Dr. Nada Nfai, PGY5, and the Chief Resident in the program. We sincerely thank you both for taking your time to join us and share insights about your program. Doctor, the floor is yours. Thank you.
Yeah, let me firstly introduce Dr. Nada. I'm Professor Yasser Orz, the program director for King Fahd Medical City and the Riyadh Cluster 2. Dr. Nada is our chief resident in King Fahd Medical City, CBGY5, and she is making a very excellent job for her chief residency. She is taking a lot of responsibility, and this presenting the program today is she will present, and this is one step. I thank her for that. I hope you all enjoy her presentation, and after the presentation, floor is open for question and answer. I will try to answer as much as I can. Dr. Nada also will answer some of the question, and I hope you will get benefit from this presentation, and we hope to find some of you after this presentation join our program. Dr. Nada, the floor is yours.
Assalamu alaikum wa rahmatullahi wa barakatuh. And thank you all for inviting us to talk about the neurosurgical training program at King Fahd Medical City. Thank you, Prof. Orz, for your time to join us today and addressing the concerns and the questions of these juniors, inshallah, common colleagues in neurosurgery. I'm Nada Nfai, Neurosurgery and Spine Chief Resident at King Fahd Medical City. And it's my pleasure to present the structure and the vision of the neurosurgery training program at King Fahd Medical City. I will walk you through the program, its structure, the vision, mission, and will address some of the aspects about the residents' life and traits to success in a neurosurgery program. Before going into the details of the training program, I would like to briefly highlight the King Fahd Medical City, which is one of the largest medical complexes in the Middle East. It has a capacity of around 1,200 beds. It serves more than 30,000 inpatients and over 500,000 outpatients annually. It's a tertiary care center that it receives daily referrals from all around the kingdom and other centers in Riyadh. The King Fahd Medical City includes multiple hospitals and specialized centers, the Women's Specialized Hospital, the Pediatric Hospital, and the Rehabilitation Hospital, in addition to the main hospital, providing a comprehensive care. The National Neuroscience Institute in specific was established in 2011 by a royal order to provide a comprehensive and specialized neuroscience care. Since then, it's been the main hub for specialized neuroscience care at King Fahd Medical City, offering advanced and specialized services in both clinical care and training. Moving on to the neurosurgery program at King Fahd Medical City, the neurosurgery program became an independent, standalone program in early 2020. Over the years, it's been led by several program directors who have contributed to its growth and development. Most recently, Professor Yasser Orz, thankfully, has been appointed to lead the program, given his extensive experience, seniority, and expertise in neurosurgery and neurosurgery training. The neurosurgery residency program is guided by a dedicated program committee It's made of about 6 faculties in neurosurgery. And the key role of the program committee is to oversee training, ensures quality and standards are achieved in training, organizes the academic activity, evaluates residents, and managed all the aspects of trainee development. Our mission is to deliver a high-quality, competency-based neurosurgical training that's aligned with the international standards. At the same time, we aim to develop neurosurgeons who are not only technically skilled, but also ethical and research-oriented and committed to patient-centered care. Ultimately, we aim to produce future leaders in neurosurgery who will advance clinical care, research, and academic practice. So, what distinguishes our neurosurgery residency program at KFMC is basically the combination of a high clinical volume, the broad exposure, and the strong academic structure. We are a high volume center, as all you know, with a wide variety of complex neurosurgical cases, which provides a strong operative exposure. Residents during their training years rotate through all the subspecialties, including vascular, open, and endovascular, skull base, spine, and pediatric neurosurgery. In addition, there is a strong supervision and accessibility of the senior faculty, creating a supportive learning environment. Daily teaching is emphasized through morning reports, case-based discussion, and regular multidisciplinary team meetings, such as the tumor board and vascular boards, which all the neurosurgery residents are encouraged to attend. The structure of the program follows the structure of the Saudi Commission of Healthcare Specialties structure. So it's basically a 6 years program of residency. It's divided into junior years and senior years. So the junior level spans 3 years, followed by the Part 1 exam. Residents then progress to the senior level, which is R4 and above, for another 3 years, during which they continue structured training and yearly assessments. At the end of the program, they sit for the final Saudi board exam, which includes the written exam, OSCE, and portfolio evaluation before being certified as board certified neurosurgeons. During your neurosurgery residency, there is about 4 rotations that you are gonna take as outsider rotation. These are related rotations. You have an ICU rotation, general surgery rotation, neurology, and neuroradiology. Each will last for about 3 months. All of them will be taken before your R4 level. After your R4 level, you'll be taking an extra one outside related rotation, which is neuropathology. And you have an option to take 3 months electives during your R4 to R6 level. So that makes up for only 4.5 years of pure neurosurgical training. In neurosurgery, your rotations are divided based on specialties and teams. So you will not be assigned to a certain consultant, but you will follow a specific, you will be assigned to a specific team. So there's spine neurosurgery, function neurosurgery, peripheral nerve, vascular neurosurgery team, oncology, skull base, and pediatric neurosurgery. Each will last for about 3 months, and during which you'll be rotating with the multiple consultants who are specialized in that practice. Our academic half day was on hold for the past few months. It's been restructured and reviewed and updated. Inshallah, we'll be restarting on 5th of May and every Tuesday thereafter. Basically, the new style is that it will be based on blocks. Each block will last for about 1.5 months. Vascular, skull base, pediatric, spine, function, peripheral nerve, and neuro-oncology block. And the style will be that the residents, it's a case-based discussion style. Residents will be presenting during the sessions, and the sessions will be moderated by seniors, consultant faculties until the end of the year, expected to start at May. It will likely to finish in April next year. It's also, there is a special topic lectures that added with invited speakers to address some of the gaps in knowledge and skills that need to be addressed. So I added this slide to address a common question and a concern of many of the applicants, which is the surgical training and operative autonomy. The foundation of that, the neurosurgical training follows a very, very long and progressive learning curve. Early in the training, the focus is on building strong foundation, prioritizing safety, observation, and understanding before the technical independence. As the resident progress, their skills develop gradually with time, and that you will be giving more increasing responsibilities, and there will be more of supervised operative exposure. However, it's a very complex thing because the surgical autonomy and training is influenced by many factors. The complexity of the case, which is a very important factor, the urgency of the case, the competency of the trainee himself, regardless of his level, and the patient's safety at the top. So early in your training, the focus is on performing tasks that are safe and appropriate to your skill level the most. As I said, the bottom line is patient safety. It comes before the technical skill. We aim to train a safe surgeon before a skilled surgeon. And I'm sure this is the scenario in any other national or international program. Skill development requires observation, however, patience, stepwise practice under supervision before for autonomy. So lastly, surgical autonomy develops progressively with experience and as you advance in your training. So speaking of the evaluation process, it follows the Saudi Board of Health Specialties regulations and standards. You can refer to the manual and their website. However, in brief, there are three main aspects they will be evaluated at: the knowledge, the skills, and your attitude. So basically, there is a percentage of attendance of the weekly academic activities. There is an end of year promotion written and oral exam. There, your skills will be evaluated by your logbooks and the DOPS forms, and attitude by the ITERS forms after each of the rotations. I'm sure you're familiar with the eligibility and selection criteria. Has set by the Saudi Commission of Health Specialties that there is an aggregate score between your exam score, GPA, and the CV score. And based on that, you'll be nominated to the interviews. Now, the topic of interviews and what are the selection criteria, I tried to put as much as information here that you need to know, not only to apply to KFMC, but to any neurosurgical program. These are very important traits that we look at in the applicants before that are applying to neurosurgery. Topmost is the safety, patient safety, and the mindset of the trainee, the work ethic, the discipline, ability to learn from feedback. Is he teachable or not teachable? Is he calm under pressure? The strong anatomical and clinical judgment also. Excellent communication and teamwork, especially that many of hours in your daily life in the hospital depends on the communication and teamwork. Resilience and emotional stability. Additionally, of course, the curiosity and academic drive. So the bottom line here is safe first, teachable second, and lastly, skilled. The reliability and the attitude cannot be taught, but the skills can be taught. So speaking of the resident's life and traits to success, what you are expecting as a resident KFMC, how we assign the duties, and how we run the program. So there is a daily distribution that is usually done by the deputy and sent to your email on daily basis. You'll be assigned to the OR of your assigned team. So if you're rotating with the spine team, you'll be assigned with the ORs of the spine team. If you're rotating with the vascular, you'll be assigned to the vascular team. If your team has no OR duties that day, you're likely to be covering clinics. Other than that, there is an emergency OR senior residents covering if there's any shortage or a need of an extra emergency coverage. And this is how we keep the assignments very fair and organized between all the residents during their training. Juniors, which is defined by R1 to R3 level, they are taking about 6 to 7 calls per month. This is about 1 to 2 weekends maximum, and at least 2 weekends they are given off in most of the scenarios. The in-call system in KFMC is designed into 2 parallel streams. So the adult first on-call of neurosurgery is separate from the pediatric and spine neurosurgery on-call. Post-call, the residents are encouraged to attend ongoing OR cases of their assigned teams. However, post-call residents are also encouraged to ask for help from their junior colleagues if they need it, and the chief resident whenever they needed to. And lately, we've been allowing the residents post-call who've been having a heavy call to leave early and another junior resident to cover him during the day, especially if there's no OR ongoing. So what are the traits to success in neurosurgery? It comes from understanding of this triangle of what I think it's the challenges of neurosurgery. So neurosurgery has 3 main challenges. You have to be aware of it and accept it early on. It has some form of emotional burden, high physical threshold with long working hours, OR times, and on-call times. And there is a narrow margin of error, especially that neurosurgical patients are very, very critical patients. They are not like any other patients. They can collapse at any time, and anything that can be missed, it can really lead to very devastated outcomes. So based on that, the traits to success in this specialty, which I think is resilience, building resilience and emotional stamina, taking care of yourself, your physical well-being, and dedication, knowledge, asking for help, being humble and teachable. This is how you can achieve success. So lastly, I would like to conclude with the statement: safety before skill, knowledge before action, and discipline before autonomy. This is how neurosurgeons are made. And thank you very much.
Thank you, Dr. Neda, for this detailed and comprehensive explanation of the King Fahd Medical City Residency Program. I have to admit that if I prepare it myself, I will never do it better than that. Or because you are resident and you are chief resident, so you know everything about the residency emotions and the residency needs. So you did it very well, and thank you. And now I have also to add that neurosurgery residency is one of the toughest. I think it is the toughest residency between all specialty, because as Dr. Nada mentioned that everything is counted. So Me and Dr. Nada are ready to answer anything you want.
Thank you, Professor. Thank you, Dr. Nada, for this amazing talk and for the amazing and comprehensive. We have a couple of questions to begin with. How many?
Ahmed, before questions, just allow me just to add something يعني, to the Dr. Nada طبعا this mentioned it in her presentation that in King Fahd Medical City we are only as I know that we are the only center we have very sub-specialized in our practice in neurosurgery in King Fahd Medical City. So we have adult neurosurgery department, pediatric neurosurgery department, and spine neurosurgery department. We are not, every department has a chairman, has his own consultant. Every consultant is sub-specialized in something. He has taken fellowship of it. So we have skull base, vascular, functional, oncology. Every one of the consultant has sub-specialized in something. And also in the pediatrics, they have the same spine team. Also, they are sub-specialized, like endoscopic, open, degenerative, and every sub-specialty is completely completely busy. We are one of the busiest center in the kingdom. We have done for last 2 or 3 years. We are approaching 1,300 operation per year. We have about have 4 OR rooms every day. Of course, we are not limited to the 4 OR rooms. We may be sometimes 5, sometimes 6, according to the cases. We are very busy center. So, yeah, this is point I want to add to you. So please go ahead for your question and for anything you want.
Thank you, Prof. We want to ask about how many residents do you accept each year?
It's different from year to year. Last year we accepted 6. Nada, correct me if I'm wrong because I am just new to the program.
Yes.
So we have 6 new R1. I think we have 3 also in King in Prince Mohammed bin Abdulaziz Hospital. They are belonging to the cluster 2 residency program. But in King Fahd Medical City, we have 6 residency resident accepted each year.
What is the operative volume for each resident, per resident?
Nada, you answer this question or I will?
So, operative volume. That's, let's say, someone in spine team and he's R4 level. Okay, he's rotating with us now, let's say. He will have 4 or 5 ORs per week. Let's say someone in functional neurosurgery and peripheral nerve is expected 3 ORs per week. Vascular team, 3 to 4 ORs per week. Skull base, this is about 3 ORs to 4 ORs per week, apart from emergency. I'm talking about elective cases only. Pediatric neurosurgery are operating every Tuesday, Wednesday, and every Thursday.
Okay, how about
Muhammad, this question is very tricky, by the way. The volume of cases are very huge. We have but the resident who assigned to the OR is involved in the operation from the sign-in, positioning, everything. But to be involved with doing he will do some steps like he's an R1 or R2, he's opening and just doing per hole, something like that. And after that, the senior resident will take some more steps according to the complexity. We have a lot of complex cases. We are tertiary referral, so most of the cases we are operating are very complex cases, which will not be done outside King Fahd Medical City. Of course, they are doing in another center like University, King Faisal, Haras Military, but we have our big volume of cases are very complex cases. So In R4, R5, they are doing more. Sometimes they are doing in R5, they are doing independently, like Dr. Nada, she did a very complex case last week, like arteriovenous malformation. She did the most of the case. But yeah, this is depend on the consultant who is operating with her and how far he will give her some, or he gives the resident some part of the operation according to the safety of the patient. Safety first. So we are giving you a chance, but we are looking for the safety of the patient firstly. So it come step by step. You will do. Unfortunately, our R6, they are very busy by studying for the exam. I don't have to say we are working now. It's not a secret. Just to pursue or to push for Saudi Council of Health Specialty to make the exam maybe in the R5 or R4. So we'll give you a chance in R6 to stay long time in the operation, because in R6 we have found some residents they are not taking clinical duty now because they are very busy by studying. It will come one day just to give you a chance in R6, but if the exam came in R4 or R5, we'll try to do that, but it is difficult because this is the rules of Saudi Health Specialty, which you cannot change easily. Okay, go ahead.
How about research? What are the opportunities available for research in KFMC?
If you allow me, Prof. Orz, I can answer this.
Sure. You are allowed to answer anything, and after that, if there is any point missed, I will add it.
So regarding research, in King Fahd Medical City, we have the database, the Healthcare Information System, EPIC. And EPIC established since 2021. I can tell you, if you are really interested in research and willing to build a database with the availability and accessibility of the system, it can be easily achievable. Having a good, properly established healthcare system that is easily accessible and accurate, like the EPIC system, it's really providing a huge advantage for the research opportunities. The high load of the cases, the volume of the cases, the complexity, the rare cases that we see a lot also add one advantage of that. And now, with regarding time, it's a bit challenging to find the time for research only. However, I have talked before about you have about 1.5 or 1.5 years during your residency training that are not pure neurosurgical training. You can take an advantage of these years to work on research, especially during your junior years. During your senior years, it's quite difficult because you will be more focused toward the OR and operating than being doing a research or just any other activity.
Muhammad and the other team, we have. I have to say that the research is a hobby of the resident, or not a hobby. Of course, it is capability of the resident to do it. The data is there, as Nada said. The data is there, the facility is there, everything is there. But our residents are very busy by clinical work, and so they are doing a lot of research through the data, case report, case series study. This is what we are doing, but I am encouraging them now to do more than that. I don't have to say that but this is for the fellowship. We have also fellowship programs, which one of the criteria to move from 1 year in the fellowship to the second year is to publish some papers. It is not the time. It is not the condition for the resident to publish as a condition for promotion from 1 year to other. This is not there in the curriculum. But of course, if you publish paper during your residency, it will count it in your career after that. And You know that also that in America now and in Canada, the resident of neurosurgery now became 7 years. One of this years is dedicated completely for the research. I don't know how whether you know that we are following their steps in our training. I don't know how whether the Saudi Commission will move by this move when they make our residency the 7 years. It's too long time for you and for us also. But research is there. If anyone wanted to do paper and publish and do research, the opportunity is there, of course, and we encourage that. And we can find funds also if the paper is valuable. Okay.
How about mentorship? Do you have a structured program for mentorship? The faculty mentoring the trainees?
Nada. For the mentorship, our mentorship is the resident is not assigned to a consultant as his mentor. He's assigned to the group. We have 3 groups in adult neurosurgery. We have 3 groups: GB1, GB2, and Group 1, Group 2, and Group 3. Every group has 2 consultants or 3 consultants. We are 8 or 9 consultants in adult neurosurgery. In the pediatric neurosurgery, they are 5 or 4 now. And in the spine, they are 8. In the spine department, it is a combination between neurosurgery and orthopedic surgery, which is very good for the resident to be exposed to neurosurgery and orthopedic surgery as the same team. The mentorship came from the group, not from the consultant only. So, but sometime if we assign a consultant as a mentor to some resident, I don't have to say why, but if we find some problem with some resident, like his level of progression is not so up to our level, so we ask the consultant to be his mentor, try to correct his deficiency, and to report to the committee about that. And this is, we find it as a good good chance for correction for some problem if it happened or it occurred from some resident. Okay, it's clear or anything?
No, it's very clear.
Okay.
How about the CV? What do you look for in the CV for applicants applying to KFMC?
Oh, okay. For the selection, we have the selection after 2 weeks. We have Muhammad. This is a good question and this is a trick question. We don't have to say. Of course, the CV we look for your level of education, and of course GPA it's important, but it is not in the CV. It's your hobbies, your criteria, and the center you are rotated during your internship, and some recommendation letter, of course, from the good recommendation letter is we have to take it in consideration, and your publication, if you have some publication. Despite that, we from your publication, we know that you are interested in the research, but it is not a must, because sometimes there is some, sorry to say that, you know that there is some fabrication, but we take it in consideration, this publication, as you are interested in the research. This is what we are looking in the CV. The CV is important, but it is not the only thing we are looking at the selection of our resident in the King Fahd Medical City.
Are there any traits you look for in the interview for an applicant to? What are other than the CV?
Of course, your manner your manner of even sitting, your manner of talking, your fluency in English, or in how to present yourself, your interest in the specialty. We give you some example of cases, like how we just to look for your response, your how to deal with emergency. your behavior. Yeah, we are taking in some consideration some personal issues. So we are just, you can you don't know what we are looking at, but from your sitting, from your dress, from your talk, from your English, from your, we are taking all of this in consideration.
I'm sorry I took too long, but we have one more question.
No. This is very important question, and I'm يعني, okay, we are ready for any question.
Yes. So in the transition from Ministry of Health to the holding company, are there any changes regarding KFMC itself?
For the residency, no change
Yes.
at all. No change at all. Everything is going the same as it is. It has nothing to do with the change transition from the Ministry of Health to holding company. There is, will not affect the residency. The only one affected is a consultant. They are, but not too much. Yani that's just not too much affection. Yani, but I think everything will go fine. Yani they are caring about to improve everything, and we are hoping this will come very soon. So the residency are not affected at all.
Okay. Thank you so much. I believe we have covered all the questions of the attendees. One more question I have seen, but I'm not sure if you could, because someone is asking about the matching process, because there are some delays. Someone is asking if you have any information regarding this point.
What do you mean by matching? We have our interview with the resident in the middle of May. I think 12th of May, as I know. After that, the program will start. I think it's starting from September or August. So
Okay, very clear. Very clear. Thank you.
Sorry. I got a phone, but I declined it. No problem.
Thank you, Professor. Thank you, Professor. Thank you, Dr. Nada, for answering all of our questions and for this great presentation.
Muhammad, if any one of your colleague, all of them are our colleague, future colleague, and if they want any question, we are ready. Any one of you has a question?
I'm reading questions from the comment section. Yes. Yes. So I think we have covered everything. Yes.
So I just for the final say that I have to thank Nada. Thank you, Nada. Really,
thank you, Prof.
You did a very good job, and you are a good model for the residency. And I am very happy that you are chief resident during starting my program, as a program director. And I hope all of you will be, you know, the competition is very difficult nowadays for the residency all over the kingdom. So, but I wish all of you the best, and we'll be happy to have all of you. Of course, we cannot have all of you in King Fahd Medical City, but anyhow, if you are in any good program, we are here, and by the way, all the programs, we are connected, we are friends, we are one family. Even if you are in another program, you are welcome to come to us to stay 1 month, 2 months, 3 months, whatever you like. Thank you.
Prof. Thank you.
Just one last comment. This presentation is recorded, so inshallah, hatta for future years, people will benefit from this talk. So thank you again.
We are happy, but send it to us also, okay?
Sure.
Thank you. شكرا دكتور نادى. شكرا دكتور محمد. Thank you all.
في سؤال
دكتور. تفضل.
إذا ممكن وش نصيحتك يا دكتور؟ What should we focus on? I'm medical student 5th year. هل أركز على التدريب الصيفي ولا ما يفرق؟ Summer training.
للأسف ما سمعتش كويس الكويشن. فيصل.
He's asking about summer training for interns and students.
It's very important, very, very important summer training, just to expose to the program and to show yourself to to the mentors and to take a يعني opportunity to know how is this program and what's going on during the OR room, and it's very, very, very important. And usually during summer program for the student or for the intern, we know who is interested, and we know, and we take this in consideration during the interview, by the way.
Yes.
Excuse me,
الله يعطيكم
Prof.
العافية.
Excuse me,
شكرا.
Dr. Nada.
Mhm.
Excuse me, my colleague Mohammed. I have a question. I know we have asked too many questions.
No problem
My
at all.
question is, thank you, Prof. My question is, what are the most common 3 reasons to be rejected? Thank you.
Oh, يعني the only thing we are caring about is the behavior. This is as Dr. Nada said, يعني surgical skills we can treat, we can train you, you can get it by time. But behavior is inherited, and it cannot be corrected. So the reason for rejection is if we find something unusual in your interview in the behavior itself, and we can يعني from our experience we can detect it early, but sometimes it not happen. But this is the most important thing, Said. This is the only reason. The other thing for the rejection is if the number of the applicant is more than our capacity. And if we are taking 6, sometimes we are asking for 4 because of something. So the matching now, or the number of the applicant is too يعني became big. So this is very strong competition for the residency in all specialty, by the way. So I don't have any specific reason for rejection except the number and the behavior.
Thank you.
Thank you. Thank you, Professor. Thank you,
Thank
Dr.
you.
Nada.
شكرا يا محمد، وشكرا وسلام للجميع، ونشوفكم على خير إن شاء الله. شكرا، ألف شكر، شكرا جزيلا.